funded health and dental insurance plans, funds and funding levels, plan design, and premium contributions. Ms. Grill.
Rebecca Grill, City Administrator, joined here with Rayanne and Alex Beaudry from Horton, and then Peggy Steno, our Finance Director. We've been working with the Employee Benefits Committee for the last couple months, trying to come up with some ways to mitigate the current challenges we have with our self-funded benefit plan. And we wanted to bring to the council kind of the challenges and some of the opportunities, and this is just the first meeting. We'll have a more in-depth meeting next Monday at 5:30, and then probably some other subsequent meetings depending upon how things go. But we just wanted to talk to the committee in addition to the Employee Benefits Committee that we've been meeting with. So I'm going to hand it over to Alex.
Thanks. So this is designed to be a high-level overview, but please feel free to stop and ask questions. I really want to talk about a few things. First, to start with healthcare trends as a whole. I'm sure you're all well aware, but medical trend in our area is about 6%. So if we don't do anything year over year and we have the same amount of claims, we would expect the city's claims year over year to go up by 6%. Pharmacy trend is almost 15%. So given everything that you as a city have to do from a budget standpoint, knowing that we're looking at just from starting from zero, a 6% increase year over year, that obviously presents some challenges. The city of West Allis has some specific trends. The first is an aging population. Rebecca, we were in a meeting with her earlier today, and she mentioned that 30% of your non-reps are over the age of 55, and 45% of them are over the age of 50. From a healthcare risk standpoint, as individuals age, healthcare costs increase. I mean, just your standard physicals once you reach a certain age become more expensive. Colonoscopies are $5,000, mammograms are thousands of dollars. So we have to watch that. I already talked about trend. Claims from the city's standpoint, just over the last few years, have also spiked from a utilization standpoint. So what we're starting to question, is this a new normal? Claim cycles tend to go every 3 to 5 years, where we'll be on an upswing for 3 to 5 years, and then we'll be on a downswing. We very much seem to be in an upswing over the last few years, so that's something else we need to manage. And then lastly, from the city's standpoint, we have very high claims utilization, in part because we do have such nice benefits here at the city. Over the last few years, we've made some very significant changes to the benefit plan. For example, the Medicare Advantage plan. We implemented a new pharmacy benefit manager that we projected to have great savings. And then even before we were your consultant, you implemented the Narrow Network with Aurora. Those are all significant changes. However, none of them impacted plan design or curbed utilization. So they were big savings, but they were one-time savings. Now everything's kind of catching up with us in this claim cycle, so we need to manage that. So some different strategies. There's different ways to cover risks, and I think everything's on the table. So our goal over the next several weeks, as we come back to you, is to give you options to help curb this, to help manage the budget. The first is premium contribution. This was already approved in the new budget with the premium increase. I bring it up because it is a strategy to help the budget. However, it doesn't curb utilization. Premiums are like a movie ticket. It's just the price of entry. It doesn't change any behavior or incentivize any behavior changes. It really just kind of helps fill a budget gap. The next strategy would be plan design. Again, you as the city have a really nice benefit of like a $100, $300 deductible. We work with almost 40 municipalities and school districts. We don't have any other municipalities that have a $100, $300 deductible. It's just over the years, as budgets have been hit, those are the first things that have been changed.
In fact, as I look at surveys that are available at WPELRA or WASBO for the school districts, etc., there are no municipal or public employers that have a $100, $300 deductible and then 100% coinsurance. It's just really unheard of. And I realized for the city, this was a mitigation factor when you went to the narrow network. But again, those savings are now that one-time deal bringing us down. We're sort of crawling back up there with the claims utilization. So
And with the Employee Benefits Committee, we're also exploring other options that we'll bring to you, including co-insurance and co-pay tweaks, all designed to help increase consumerism and better decision-making through your health plan. Another strategy is, and I'm going to say this a little bit tongue-in-cheek, is to get younger. Obviously, we can't fire all of the older population. That's certainly not what I'm suggesting, but there are a couple different ways to potentially do that. So one, can we set up an alternative plan design to help attract younger talent? Not everybody in your population, I would assume, wants a $100 single deductible. Can we offer multiple plan designs that may attract someone of a different generation to come work with the city? And then second is wellness. It's something that the city has taken very seriously and something that we're looking at bolstering in the future. Can we get our population, even though their actual age won't go down, can we get their health age down? Can we help them make decisions where, even though I may be 50, my actual health age is like 47, as an example. Humana does a great job of tracking that, and we look to bolster that program as a strategy. The last strategy, before I turn it over to questions, would be to reduce risk or exposure. Can we incentivize or create opportunities for employees and their families to leave the city's health plan, but also have a better benefit? So one example of this is a family savings plan is what it's called, through Network Health Plan. And what it does is it would incentivize your employees to take their spouse's health plan if they're available to them through another employer, and they will, not only would the city then pick up any premium differential, they would help pay for any out-of-pocket expenses. So co-pays, deductibles, co-insurance. So even though I am now off the city's health plan, the city is going to help me pay for those bills. So it's much different than like a spousal surcharge or a carve-out where that's more punitive. This would actually be a richer benefit and incentive that not only am I, being encouraged to leave, but I'm in a much better position financially.
And that risk is limited because you'd be paying only the differential of what they pay today versus what they would be paying at a new employer. So if I'm paying $200 a month and my spouse is paying $300 a month, it would be that $100 delta only. And then the exposure on any sort of claim is also limited by the maximum out of pocket, which is mandated by federal law. So you're only paying claims, A, if they're incurred, and B, if they are, you still have a maximum risk line in the sand. So what this does is, if you finally have a way, because people always ask, well, why don't you pay me to get off your plan? Well, the reality is when you pay people to go off your health plan, cash in lieu of benefits, what happens is you lose all your healthy people because your sick people are going to stay on the better plan. Well, now, doing this kind of risk mitigation, I am able to make the spouse's plan the better plan because it's 100% coverage to their out-of-pocket maximum. So, and it's all tax advantaged for the city of West Allis because you're paying the providers directly, so it's still considered a medical expense. So it's a third plan offering, if you will.
So in summary, we just want you to know that we're working on a lot of different options. We're working with the committee, and in subsequent meetings, we'll have much more data points with actual numbers behind them. But we wanted you to be aware of what we're working on, so it's not a surprise when we ask you to vote, that you actually have some time to kind of think it through and ask questions and those types of things. So unless you have anything else to add.
Well, I would just add a couple of things. I know it's the first week in December, but open enrollment is a month and a week away. So some of these decisions obviously are going to need to be made relatively quickly. With what's going on with the claim cycle, I think not only have your claims been going up, maybe because we have a slightly older population, which again isn't unusual, and we have a lot of retirees between 55 and 65, and they're getting stuff taken care of. As we age, we need it. The hips, the knees, the rotator cuffs, all of those things, even if they're elective and fairly mild, they're still at cost increases. So we're right now in sort of the conundrum of we don't have a lot of shock losses, for lack of a better term. Our high cost claims are $500,000. Those are actually substantially reduced right now. We're doing well there. It's all the $55,000 to $105,000 claims that are really starting to stack up, and some of that's coming from prescription drug services alone. So the mitigation and the ability to maybe reduce our exposure and have some of these people voluntarily choose to leave our plan and be in a better spot for themselves and for the city is really viable, because we're stuck between technology right now. Technology and claims. People can get new parts. And they can be made to feel, or they can be made to live with disease much, much longer. So we want to take care of people's health and we want to do the right things, but we also need to be respectful of a budget and the ability to continue to attract and retain and do the services the city needs to do.
Yeah, and so just to clarify, these are just things to talk about at this point. There's no formal recommendation, nothing formally before the council yet, just something to talk about.
Just really wanted to bring to light some of the challenges, and I don't know if you mentioned about our fund balance and things like that. That's really,
Mr. Chair, that's what I was going to ask. So what's the problem?
it's taken a significant hit over the past years, because as Alex says, we made changes, but they didn't make any significant,
We didn't bend the utilization curve at all.
not at all.
In fact, we seem to increase it.
Yes.
So, yeah, exactly, and that's not to say we didn't save money from those changes, we did save a lot of money. We would be in a much worse situation right now had we not had a new pharmacy benefit manager, and had we not moved our post-65s to the Medicare Advantage plan and not gone to the defined network. But our claims, our utilization just keeps going, so our fund balance over time, I mean, it's dropped a lot. We're expecting this not to be any better year. We keep saying, oh, in 2017 we had a bad year. We had that same bad year in 18, only in 18 it was really
Worse.
bad. 2019 is not looking a whole heck of a lot better. So we still have a fund balance, we're not, tapping into the general fund balance or anything like that, but we can't go on like this and have utilization as high as it is today, and the city paying for as large of a portion of the cost as it is today, and still be successful with our self-funded plan going to the future.
Mind if I just
Sure.
ask a bunch of questions?
Go ahead.
What is our fund balance now, and where are we projected to be at the end of next year?
So our fund balance, going into 2019 was 4.4 million.
Oh, going into this year, okay.
We only have 6 weeks, but let me tell you, it's not been a good year. Originally, 2 months ago, we were looking at like around $100,000 loss. Now, sitting here before you today, seeing what the claims have been in the last 2 months and what they could be for the rest of the year, drugs and medical, we could be taking a 900,000 or more hit.
And that's kind of an interesting thing, because in the year where you have a bunch of the big time shock losses, you get stop loss reimbursements, we get money back. And that's mitigated some of those difficult plan years. Now we don't have many stop loss reimbursements because we don't seem to have any of the really giant claims. And by the way, that's another thing to look at, is where do we set our specific deductible level, because we did bring that down $100,000 when we came on board. Maybe it's time to maybe look at something that's even lower, so we mitigate that risk from 175,000 down to maybe 100,000.
That's the stop loss.
So
That's
yeah, so
stop loss.
basically, any claims up to 175 are ours, anything over 175 is our extended risk.
So if we have that, a bunch of them in the 50,000 to 125, that's all on the city right now.
And we have a big list of those.
So we're down 900,000 approximately on the year. That fund balance going forward, if that continues this trend, hypothetically, we do nothing 4 or 5 years and that balance is gone.
We don't have a self-funded plan anymore.
And then what?
Quicker than
Then
5
we'd have to
years.
go fully insured, and we'd be basically, and then if our claims utilization was high, we'd be looking at these large increases every year. There's no, you can of course change the plan, but you couldn't even find a plan out there right now in the fully insured world like our plan. Not even close.
And we would have to do significant things to stay in our expenditure restraint and levy limits to afford moving from a self-funded to a fully insured plan. So that would be probably significant cuts in services and personnel. So that's why we're coming now, we want to be proactive.
So not everyone understands the idea of expenditure restraint. I think we do because we're on this committee. Can you explain it so other people listening? As simple as you can. Basically, the state says we currently have this much that the city spends, and next year we're only allowed to increase it by a rate of inflation plus perhaps a bit of growth that we see in the city, correct?
Correct.
And that's our ceiling. So everything the city does must be funded within that
Right, in order for us to get the payment.
in order for us to get
the
close to $1.5 million from the state.
Right.
So,
So this year, we were only able to go up $1.455 million.
and we did that mostly through salary.
Correct.
Increases.
Yes. And a lot of it was the represented salaries. So if we keep going that, we won't be able to afford these increases in health insurance. Because when the premiums go up, not only does it go up for the employees, it goes up for the city too.
Yeah.
So
So it's not just, we've got this problem with insurance costs going up. The problem is we can't go to the taxpayer for the extra even if we wanted to. Unless we wanted to burden
you
a
would have,
substantial amount, $1.5 million, just to overcome that first dollar above and beyond
Right.
expenditure restraint.
And something that Peggy mentioned earlier about, if we continue on this trend, we have to get out of the self-funded world from, I think, unless you have a different opinion from where we sit, that's not a viable option. Because you go from a small piece of risk that you have today, plus claims, to fully insured that is a guaranteed expenditure. And fully insured claims do not come back down, or not claims, premiums do not come back down. So if you're paying $12 million roughly today in premium equivalents, next year when you're fully insured, that's gonna be 12.5, and the year after it's gonna be 13. There's no coming back from that. So not only will you have first year costs of trying to change from self-funded to fully insured, it's too much of a burden if we're already having these types of budgetary constraints. So from where I sit in my chair, I couldn't recommend that. So we have to get our utilization and our costs under control, because I don't see that as a viable option for the city.
And if you wait, to Alex's point, if you wait to do it until you absolutely need to do it, you won't find a buyer. It'd be, 25, 30% rate increases, and you still have to pay your runout claims and the cost of administration, because those claims that have already happened aren't gonna be covered by the new fully insured carriers. So we have to get this under control faster than, it's not even only a fund balance issue, it's an issue of how are we going to keep this a viable and exciting offering where you're still substantially above average in the public sector, so you can attract and retain, but it's affordable.
So that gets my next question then, Mr. Chair, is are we going to see some comparables for our comparable cities? Are we going to see what do they have? I mean, I want to take into account the whole benefit. We look at salary and we kind of consider it healthcare. It's all one big compensation package. Are we going to be able to see what the other cities
started
have,
putting some things
salaries?
together with, I was looking today at the state, the county, and the city of Milwaukee, and so we'll have, and then our other comps, just
We had many of
surrounding
those a
areas.
couple of years ago for the committee, if you'll recall, we showed your comparables, I think we just have to update that.
2017, we had that, we had a survey done with all of our close comps, so we can update those. At that time, the deductible level, we did have a few, we shared under $500 with a few people, La Crosse, Janesville, Oshkosh, and Menominee Falls, but they were probably not 100 and 300.
They were not
Maybe
100.
three of the
They were
four
400,
going
La Crosse is 400 and 800, because I work with them, and then they have 90/10 co-insurance after that. The Village of Menominee Falls was just forced after a 23% rate increase. They are fully insured. They went from a $250, $500, 100% to a $1,250, $2,500 deductible, 90%. So it's a significant change just to meet their budget of 14%. So similar stories with both of them, and it's healthcare costs are going up.
Mr. Chair?
Alderman Weigel?
If Alderman May's done? Yeah. No silver bullet here, I see, in a list of like 6
Not yet,
different
we're
options.
trying.
No, I get it. I understand that. I guess on the multiple plan thing, I thought we were moving towards fewer plans that we were offering for simplicity's sake. And I understand the idea, But that's gonna make it more complicated for
From that
us.
standpoint, the city, when we began working with you, had like 56 plans, and they were all
Yeah.
very unique based on date of retirement. This is much more generally, like, everybody would have a choice between one or two plans. I'm not talking about adding
Okay, you're not adding like
12
seven or
plans.
something.
No, this would be,
Okay.
okay, we have our very traditional PPO plan, maybe the high deductible health plan option that we're offering.
Mm-hmm.
Maybe that's not a narrow versus broad network decision, maybe it's a true deductible decision, where maybe I, the same network, but I take either the 100, 300 plan, and then maybe I take a $1,300 HSA plan. Just as an example. Obviously, we have to vet that through, we have to make sure it makes actuarial sense, because the last thing we wanna do is artificially reduce the premium, and then we still have the same amount of claims, because that just puts us in a bigger budget hole, so that needs to be explored further, but things that we are exploring.
And I assume that we're gonna look at this, getting people to go on their spouse's insurance. We're gonna have an idea of, I mean, is that data we already have from our employees?
Piece of it, we're looking to get it, well, we have a estimate on what this would look like. We're going to give the folks at Family Savings Plan a little bit more data that we have, so that they can do a little bit more, likely baseline.
Right.
In 2018, we did a survey of employees, and we had 300 respondents, and at that time, there were 43.17% of those people took our insurance because it was better than their spouses. So of the 300, you would guess that at least 40% of them, their spouse has some type of plan. And this plan, as we learn more about it, it's a win-win for the city and the employee, because basically, we'll find out more next week, but it's not anything more out of their pocket. It's actually, in some cases, could be less.
Well, and as we look to what we potentially might think about change, we're being very mindful, as we go through this with the benefit committee and even with the actuaries. It's not just change to make a change. It's what changes will actually drive a different behavior. So if, for example, you do something different with office visit copays, and suddenly you introduce telemedicine, and you do a real big push around that, and they can get that for $0 cost, do some people change their behavior now and start to use virtual visits? So there's all kinds of, we're not looking to just do something's sake, but the reality is once I'm past $100, which basically takes a ripped nail these days, it's Katie bar the door. So you have to look at what's reasonable. Even Medicare has increased their deductible on Part B from $100.
The state plan no longer has any plans that look like what the city has. They have all increased to, I think, a minimum of at least $500. Some are even higher than that, so even the state's moving away from
Mr. Chair.
With me.
So I see our problem is kind of threefold. We've got the depleting fund, which we need to keep going. Expenditure restraint, which if we're going to absorb it through, taxes, we'd have to cut services and staff, I would guess. And then the third problem being employee retention and attraction. I don't think we want to have a mass exodus, and we want to take care of our employees, of course. We cannot incentivize people who are over 65 to use Medicare, correct?
We can't.
Okay. And education, are we doing enough with education? I mean, it came to my attention that there are still some employees who believe that, and retirees, that if you want to ride to the hospital, the fire department will give it to you for free. That does not exist. That costs the city a lot of money.
Well, it used to exist.
Yeah, used a long time ago, right?
Oh, not that
couple
long
months ago.
Up till a couple months ago.
You're kidding me.
No. So, yeah, it came to my attention too.
Wow.
But yeah, we've talked about things like that. I have been going, we're not doing enough education. I think we would all agree that we would like to get to your employees more, and there's a couple of different ways we're looking at drip campaigns and how do we get to them. One of the challenges, of course, is we have meetings and people don't always choose to participate. So we'll have to tackle some of this during open enrollment. Obviously, we'll have to make some time for some one-on-ones. So,
There are
One
services where
thing-
you can call in. I'm sorry.
Sorry to cut you off, Alderman May. One thing that we did talk about that was built into next year's budget that I'm going to propose that the city strongly consider is a mobile app called HealthJoy.
As I was just going to ask about. Okay.
They're a third-party vendor that runs a mobile app. It's about $6.50 PM per employee per month, sorry, that the city would take on that cost. And so then it would be free to your employees to use. And what this app does is it's like a personal concierge for medical services. So if I need a knee surgery, I can go to the app and they can set up that appointment, make sure that I'm going to an in-network provider and I'm seeing the best provider based on cost and quality outcomes. Same would be true if I need a prescription. They can tell me which provider in the local area, Walgreens versus CVS versus Walmart, would have the best cost for those
so
medicines.
you're on the Good RX?
Yeah. If I have a service that I need like urgent care services for, so I'll use my son as an example. He gets croup like 3 times a year, it seems like. I go on the app and I say, hey, this is what I think's going on. Can you help set an appointment? The app will ask me, do I think this is something that telemedicine can do? Yeah, probably. So then they'll give me a link right on the app as I'm talking with AI, and I click on it, and that's now free to me to use. And it's a $49 visit versus a $175 urgent care visit that the city's paying. So that's where you get the return on investment. The other great part about this app is it has a benefits wallet, so it contains all of the city's benefit information. So if I don't know how my benefits work or how much my deductibles met or my EOBs, all I have to do is click on the app and all of that information is stored in there. And the city can do up to 4 push notifications sent every year. So as technology gets better, email gets less effective. If that makes any sense? I don't know about you, but I use my employer kind of tongue in cheek. We get a Monday morning email communications. I delete that email as soon as it comes in my inbox. I get a text message, I'm gonna answer that, or at least look at it as my phone vibrates. So can we use that technology to better communicate with your employees? Say, hey, we have a wellness fair coming up. Can we push that out via text message? Or the app itself, if I'm not using or engaging in it, they'll say, hey, don't forget about us. Have you sent your primary care visit for the year? Just those touch points every year so that we're not just communicating with your employees around open enrollment. They're hearing from the city every 4 to 6 weeks. So it's really cool technology. I'm going to set up a demo with the city. It's an expense that Peggy and the city has budgeted for. So I'm really excited about it. I think it can help with education and consumerism and all of those things. So
But if you were in line, you know, I mean, think about the ability to do something just as strange as you're in line at a theme park in Florida with your kids, and somebody says, "Hey, I'm starting to get a little bit of a sore throat." Hit on the app; it'll literally make you an appointment through the virtual visit if you can do it, or give you GPS directions to your nearest in-network provider. That's low cost, so maybe it'll say, hey, did you know there's a Meijer right down the road here and they have a quick care or fast care clinic visit, this will cost you $10. Here's GPS instructions on how to get there. So just different things. This is great for people who are on the road a lot. Think of your public works folks. And what I think people forget about with virtual medicine in particular is that you can actually set your appointment. So if I'm thinking about it right now, and I go ahead and I can say, my break is in an hour, can I have, so for example, if this was 8:30 in the morning, my break's at 10 o'clock, can I have a meeting with the virtual visit at 10:05? That's when the virtual visit will call me back. That's when telemedicine will call me back. So I don't have to do it when I'm in the middle of a conference or something. So it sets all that for me. People like having a concierge. People like having somebody or something do it for you.
That's called HealthJoy.
HealthJoy, yes.
So I think a lot of time, again, the terminology in healthcare is very difficult.
Oh, sorry.
No,
If I use acronyms.
no, I understand it because, you know, through doing this, I understand it, but I think when people hear telemedicine, they think they're talking to a computer. You can get on and speak face to
Virtual
face.
visits are only face-to-face, so
Yes.
it's through your
With-
smartphone, a tablet, a computer, yes, and it's
And
with
it's-
an MD.
Licensed physician.
Yep, or a nurse practitioner, right?
No.
Never
They're all
a nurse
MDs?
practitioner. Because in order to be able to e-prescribe, it has to be an MD.
In the United
My wife's
States?
an NP,
Yeah.
she can prescribe.
She can prescribe in
Person.
Wisconsin.
In person, okay.
In person. She cannot prescribe over the web.
But whenever I do a visit virtually, they ask me what state I'm in. And I'm going to get a licensed provider, medical doctor in that state, that's licensed in that state, so that they can send my prescription to the nearest pharmacy, wherever I'm at.
So if you have an
literally-
earache, instead of sitting in an urgent care, which is gonna cost all of us more, the employee more pain sitting in that emergency room listening to everyone else with their issues.
I've literally pulled off into a wayside, had my virtual visit and said I'll be in La Crosse in 10 minutes, and I've sent my prescription to the nearest Walgreens.
Or if you have kids, the last thing I want to do is take my 15-month-old son at 10 o'clock to a children's urgent care and wait for an hour to see a doctor. Like, I can do a virtual visit on the spot, he can go back to bed, I can go to Walgreens and pick up his prescription. So it's not only convenient, it's cost effective, and it does all the same things that urgent care can do. So how can we utilize technology to help with these issues as well? Any other questions?
Yeah. All right, well, thank you very much.
More to come in the next couple weeks.
Yeah,
Stay
yeah.
tuned. Merry Christmas.
All right, anything else properly come before the committee? Have a motion to adjourn?
So moved.
Second.
All in favor, say aye.
Aye.
We're adjourned. All right, thanks, everybody.
A lump of coal would be welcome, though, right?
One of our friends of downtown West Allis, Peak Physique, and I'm here with owner Ricky Garbo. Ricky, how are you doing today?
I'm doing great.
So thanks for having us in here. So how long has Peak Physique been in West Allis?
Well, technically almost 4 years, but 2 years of that was operating out of my basement in a duplex.
And why West Allis?
When I was doing the process of getting my business plan going, you know, I considered a couple of different regions here in Milwaukee, and I live in West Allis, and I've learned more about, you know, just the personal beings of the city. Like the mayor loves, you know, local businesses, rent's affordable, and I already had made a very great client base of West Allis people, so it just made sense, and I haven't regretted it for a minute.
And your business is growing, which is
Yes.
awesome. So if you could walk us through a consultation, somebody wants to come in, they want to get fit, how do you help them out?
Well, first thing is to get to know the person, because if you don't know the person, nothing's going to happen. So I get down to learning what the person is looking for, what their expectations of me would be, and I kind of like to get to know their background in fitness, what makes them motivated, and also a really important part of it is diet. You know, I like to sit down and just kind of learn their diet habits and kind of get on track with what their weaknesses are to get things rolling.
And is there something that like all your clients have to do? Like they all have to go on the treadmill, or they all have to do Pilates or yoga or?
Oh yeah, there's a lot of things that we all have to do, but I'd probably say the most common complaint is how much we do squats. You know, one thing about squats is there's about 150 different ways you can do them, and we probably cover about 40 of them a week, it seems sometimes. So, you know, lots of squatting, yeah.
So when someone comes in for personal training, how often should they come in?
I
During
like
a week.
to see somebody 3 to 4 times a week.
And about how long is a session?
45 minutes if you're doing group, and a half hour if you're doing one-on-one.
And so what's the difference with group versus individual training?
So individual training, I really try my hardest to reserve for people who need, you know, some coaching on how to do things with correct form, and maybe just some time to get conditioned and comfortable with exercising. Or sometimes people just want one-on-one because they're more into a personalized approach. But my group training thing, in my opinion, is a little bit more successful because there's more levels of accountability, because once you get immersed in the program, you start making friends, and it's not just me, you know, holding you accountable, it's your friends that you work out with too. As long as you're into that group form, it's the best way.
And you actually have something in addition to your group classes coming up in January, your kickboxer classes.
Yep.
So can you tell us a little bit about that?
Yeah, for sure. I've personally been into the mixed martial arts for over a decade now, and every time I've ever had a client work on me with the kickboxing combat related training, in my 10 years as a trainer, I've only had one person say they didn't like it. So it's very popular, it's a great stress reliever, and it's also a really good workout. So yeah, starting in January on Thursdays, 2 times a day, we'll have that class.
And what other types of specialized classes do you do besides like the kickboxing?
We have a group class called Small Group, where it's cut off at 4 people that work with me, and that's more related to weightlifting. I cut it off at 4 so I can watch everybody closely and make sure they're doing everything with correct form, as well as the right weight for them. You know, because sometimes if you're in a group of 8, it's easy to not push the weight as heavy as you could, or it's also easy to be doing something wrong and me not catch it. So Small Group is a really good personalized class. I also have on Saturdays a step class that is very popular. It's full every time, and people just love the high cardio, high energy of that one.
So you've been doing this for 4 years as a business, but how did you get into personal training to begin with?
I've always been big into activity. You know, I played sports in high school, and I got into mixed martial arts after I graduated. I used to compete in the amateur level in the cage, in the octagon, and I decided it would be best for me as a professional fighter, which was my plan at the time, to get into the business of fitness too, so I'm always immersed. Well, somewhere along the way, my love for training outweighed my love for fighting, and that's kind of where everything went. I got a degree in kinesiology from the University of Eau Claire as I was going along my way, and like I said, I kind of fell in love with the training aspect of things a little bit more than getting my face kicked in all the time.
Yeah, I don't blame you.
Yeah.
So also at the gym, I mean, it's a small gym and it's local, but also you have a lot of technology integrated into the gym. And one of the things is on your screens, you actually monitor people's heart rates. So how does that help them with their fitness goals?
I've found it to be beneficial in many ways since I incorporated the MyZone monitors into the business. At first I was a little skeptical, and I was looking at it more as a way to get millennials motivated, because the monitors themselves give you what we call a workout grade every time. You know, it's a number that tells you, you know, I worked hard, or I could have pushed it a little bit harder. So that's kind of what I initially thought would be great about it. But another thing that it does is it keeps people motivated across a month, because MyZone itself collaborates all the numbers that you accumulate from day 1 of the month to day 30 or 31 of the month. And that allows you to compare yourself to other people that work out here, you know, your previous month, your previous year. So it's just kind of a way to keep you focused on a different level.
So at the beginning in the intro, I had mentioned you are a friend of downtown West Allis. So for people that don't know what a friend of is, it's somebody that is a business that's not located in our 6 blocks, but that supports our 6 blocks, and we in turn support them. So why did you become a friend of downtown West Allis?
I'm all in on the community thing. I'm all in on helping other small businesses. You know, I even have some things that I incorporate into my group packages that involve getting discounts on other small businesses from West Allis exclusively. So, you know, jumping on board with something like your movement is what I'm all about.
So if somebody wants to come in and schedule a consultation or sign up for a group class, how can they get a hold of you?
Oh, there's a couple different ways. You can call me or text me at my number, which is 414-243-0242, or you can go to my website, mketrainer.com,
And where are you located?
8303 West Beecher.
Thank you, Ricky, for joining us today on Behind the Bid. Again, my name is Emily Einechner. I'm with the Downtown West Allis Business Improvement District, and we'll see you next time on Behind the Bid. Welcome to Behind the Bid. My name is Emily Einechner. I'm with the Downtown West Allis Business Improvement District, and today we are at Model Empire. I'm here with manager Ronnie Dahl. Ronnie, how are you?
Doing good, thanks for having me.
No problem. Thanks for being here. So how long has Model Empire been in West Allis?
So we started down the street. My grandparents actually opened the store back in 1970s, kind of by 63rd and Greenfield Avenue. And then we moved right across the street from where we are now. And in 1992, we actually moved to our current location.
And what do you like about West Allis? I mean, you've been here since 1970. You haven't moved it anywhere else.
It's a really nice neighborhood. With the Bid, we have a great sense of community, and it's really a convenient location with all of the interstate access and major roads around.
So, Model Empire, it's not just models, but how many different types of models and replicas do you have at Model Empire?
Plastic kit models themselves, we have probably over 5,000 different types, as well as for the die-cast pre-builts, we have over 5,000 different types. We have models and slot cars and die-cast and all kinds of different things.
And if somebody's just starting out looking to get into the model building, what type of model would you suggest they start with?
Well, for a younger beginner, we have what's called a snap fit kit. Those are, probably about 20 to 50 pieces depending on the kit itself. And those take maybe about an hour to put together. If it's more of an adult who has more fine motor skills and things like that. We suggest more of like a regular skill level 2 model kit, which is going to require gluing and painting, but is a little bit more for them to do and probably a little bit more challenging for them.
And now you guys do a lot of online sales, so how has that affected your business?
We actually have a lot less foot traffic in the store now with all of the online, but we do sell quite a bit online. We have our own website, and we do also sell on Amazon and things like that to kind of work with that online competition that we do have.
But now, as far as foot traffic goes, you have a big sale coming up in November, and I've been down here for it. You got lines all the way down the block. So what is the sale? What does it entail?
So that's our annual November sale. It's always the first Sunday of November, so this year it's November 4th. And we open our shop from noon to 4 p.m. And we pretty much don't sell any of our regular merchandise that day. We do a major transformation of our store the night before, and it's all scratch and dent die cast, pre-built kits, started kits, open kits, things that we've gotten in collections or returns, just a way to kind of say thank you to our customers and give them a lot of good deals during the sale, as well as kind of get a way to get rid of some of those other pieces that wouldn't usually be sold in our store.
And if you've never been here, second floor, it's full of die-cast cars. It's crazy. So I can see why you want to kind of clean house in November.
Absolutely, absolutely. Get everything, kind of cleaned out and ready for Christmas. And it's a great way for modelers to kind of pick up some things that they haven't seen in a while, or we even have separate parts bags and things like that. So a way to get different parts and really good deals that they're not going to get any other time of the year.
And so something that's not models, but it's really unique to your store is the slot car race, or the slot car track, that you have the races on. So is that open to the public?
It is. We have slot car racing every Tuesday night. Gentlemen start getting here. We do have a couple ladies that do it too, but they start getting here probably around, I know some start showing up as early as 4 o'clock, but we really start doing races at about 6 o'clock, and they do 2 different classes. You can definitely stop in for more information regarding the classes, and our gentlemen that work in the store really, they're involved with it, so they're, know a lot about the classes and things like that.
So anybody can just show up, or do you have to like make a reservation to come, like let you guys know that you're showing up? Or?
For the actual Tuesday night racing, you don't have to let us know, you can just show up, but you do have to have your own car, and we do suggest you have your own controller too. If you want to come and rent the track, that you can make a reservation. Our track is available to anybody during our regular business hours, and you do need to have your own car, but we do have controllers for rent. And if you do buy a car from our store, you get an hour of free track time.
And about how much is a slot car track, so if somebody wants to start getting involved in that?
Slot cars themselves that would run on the track can range from about 25, and kind of a nicer car is going to run you about 50. There's obviously really special ones and collector's ones that you can go well into the hundreds, but the majority of them are probably in like the $30 to $50 range.
With over 5,000 types of models, where do you get them all from?
So we actually buy directly from manufacturers a lot of the time. Sometimes we have distributors that we work through, but like a large company that we deal with right now is called Round 2. They are producing Auto World, which is die-cast, as well as HO slot cars. They also are the current owners of AMT, MPC, Polar Lights, Lindbergh, all of those model kit companies. So they've kind of gathered those companies up and purchased them over the years, and so now they have a very large presence.
So are there any brands that sell better than others?
Not necessarily. Obviously, brands that have been around for a long time, they become a trusted brand for the modelers or for the slot car racers. So people who are in like doing the HO slot cars really like the company AFX Tomy because they've been around for so long and have become a really trusted name in the hobby industry.
So if somebody wants to stop in and pick up a model or rent some time on the slot car track, how can they get a hold of you?
So you can stop in at our store. Our address is 7116 West Greenfield Avenue in West Allis. You can give us a call at 414-453-4610, or you can reach out to us through our website, which is modelempireusa.com, and our email address is info@modelempireusa.com.
Well, thank you, Ronnie, for taking the time to sit with us today on Behind the Bid. We're at Model Empire, and we'll see you next time on Behind the Bid.
Hi, I'm Jerry Deshane. Welcome to what we call the Local Perspective. We try to make it very real here on the Local Perspective, so today I came down with the flu so we could talk about public health. And little did I realize that my guest, who is a public health services director, did the same thing. So we're really dedicated to you. Seriously, this month's issue of the magazine talks about community health, whether that's the latest flu that's going around, the Zika virus, West Nile virus, lead in our water supplies, all of these things that are occurring in our environment, who's watching out for that? To all of us, health is a very personal thing, but there's a community element to it. My guest is Ann Christensen. Ann is the director of the North Shore Health Department.
Correct. Yep.
Good morning or
morning.
afternoon. This runs at different times.
Sure.
Thank you for being here. And I hope are you on the upside of this thing or on
I
the
believe
downside?
both I am on the upside as well as the community is on the upside. The CDC reported recently that the flu is peaked and it's now on its way down. We'll have a couple more weeks of this, but largely it's reached its peak.
Okay, now I'm blaming my granddaughter. She's sort of the epicenter.
Sure.
Is that where it all started? Little girl,
Your
3-year-old?
granddaughter?
Yeah.
I'm not sure of your granddaughter solely, but it is certainly something that happens amongst kids. Younger kids and older adults are the ones that are most vulnerable to viruses like the flu.
Okay. Well, one of the public health, community health, it's one of those things that local governments do. In Wisconsin, and there are 86 community health departments?
Right.
Yours is a little different. Most of them are with the county.
Yeah.
There are some with the city, but North Shore, describe it for me.
Sure. So we are located in northern Milwaukee County, and we are a sub-county, multi-jurisdictional health department. So you're right. We're unique in that we're not county-based, but we are a consolidation of 7 communities in northern Milwaukee County. And that consolidation took place in 2011, 2012 is when it was implemented.
So what's your mission? What do you do on a day-to-day basis?
So public health in general, whether it's our department or any of the other agencies across the state, are there to promote and protect the public's health. Broadly defined, we have state statutory functions as well as we're engaged in all aspects of understanding preventable disease and disability in communities and working to prevent and to optimize health and quality of life. It's a very broad mission.
So this thing I've got in my head and chest, was this preventable? Could I have avoided this?
Yes and no. So in terms of what we recommend for people, certainly in the fall, is to get that flu shot because that has shown to make a difference. Now there's discussion about whether this year's flu shot has made a difference or not. So in any given year, it may or may not be as effective, but what we're seeing in our data is while it's not 100% effective, it is certainly effective at reducing the severity of flu illness. So that's certainly one thing that people can do right off the bat to prevent the illnesses that we may have right now. However, there are some basics that people oftentimes forget, and one of those is hand washing. That is a strategy that's very simple to do and can prevent a lot of illness out there. And then staying home being another one. If you're sick or have the symptoms of flu or other we see a lot of gastrointestinal illness, so stomach-related illnesses, and staying at home and keeping yourself well and getting better at home versus pushing through and going to work or school with those symptoms. That will really minimize the extent of a situation where we have what we call an outbreak.
There's a lot of things I want to get into and talk about, but since we're on the subject, isn't that whole notion of if you're sick, stay home, it's sort of counter-cultural with us, isn't it? I mean, it's, we power through, we'll go to work, I can do it.
Right.
And yet all we really accomplish is we take out half the office, right?
Exactly. So one of our roles is to inform employers, not necessarily for the flu, but for certain conditions, if people do need to stay home, our job is to enforce those orders that people need to stay home until the symptoms that they have either been shown to be resolved with a test or resolved symptomatically. So again, in certain conditions, that's one of the roles that we play.
Okay. So what leads a person into this? I mean, you've got a medical background, obviously. You were with the medical college, you were with the University of Wisconsin. What draws you to this field?
So my background is actually more social science than clinical in that my undergraduate degree is in psychology, and then what I was looking for after that in a career is something that was much more applied research based. And so public health, now this was 20 plus years ago, and a very different environment in Wisconsin that is important to kind of talk historically about, but wanted something that focused on health and applied research. And so public health kind of fit that area, or that interest of mine. And so there were no public health schools in Wisconsin. There was really no place to go here locally. So I ended up at the University of Michigan. They have an excellent school of public health there, and did my graduate work there. And then came back to Wisconsin, with my newly minted degree, and there were very few jobs for someone without a clinical background, but with a master's in public health. So, trying the local government route, there were very few positions that were available to me. Most of those positions had a requirement for a nursing degree at a bare minimum. So ended up in academia, worked at the University of Wisconsin-Madison for Patrick Remington, who's kind of one of the large known figures in public health in Wisconsin. Sure. And we talked earlier about my work started with the tobacco control program over there when in the late 1990s, when the state was really focusing on its tobacco control efforts and the indoor air policies that were being implemented at the time. So that's where my career started, and ended up staying in academia for quite a while.
It's kind of a weird bit of trivia, but at the League, we're 120 years old. Mm-hmm. And I was looking back, one of the first women who was elected to a local public office was the Oshkosh city nurse. Oh. And for some strange reason, that was why you'd want that to be an elected official. I'm not sure, but was that the mindset, even as recently as 20 years ago, that you're basically the city nurse?
For the most part, and really as we look at public health in Wisconsin, very specifically over the past 20, 25 years, it's really changing, but it's both Wisconsin as well as nationally where we see these trends happening of the public health department's role. And actually CDC has kind of coined this as 3 phases of public health. So we had public health 1.0 is what they call it in the very early part of the 20th century, where the focus was on sanitation and really understanding infectious disease, promoting vaccinations. And then we had public health 2.0 in the late kind of 80s and 90s, where the focus turned more to kind of what we're seeing a little bit now, but chronic disease. And now we're in much more of a broader phase of public health with the passage of the Affordable Care Act, and really understanding what our role is as people become more well-insured. Our role offering clinical services is lower and lessened over time, but our role in really being that, and I talk in the article about this community health strategist, of really understanding what are the conditions that are driving health in a community. That's where our role is evolving in this 3.0 phase of public health.
And how recent is the 3.0 phase?
It's quite recent, I would say within the last 5 years.
Okay.
Yeah, Robert Wood Johnson with their county health rankings really is driving a lot of this focus on that. Health is driven by much more than just access to clinical care and quality of clinical care. We talk about that being about 20% of what drives health outcomes. And we know the contributors of health behaviors are great, especially tobacco being one of those. That's been on the public's mindset for a long time. But other health behaviors like wearing a seatbelt or not excessively drinking, those type of health behaviors that individuals perform on a day-to-day basis contribute to health, maybe about 30%. The other drivers of health are really these social and economic conditions that people live in that contribute to their health. So can people walk in their communities? Do people have access to education and economic income that really can allow them to live optimally healthy lives? And then the physical environment playing a role in one's health as well. And so public health really understands all of those entities working together, and that's where we play kind of a unique role in understanding in each of our communities how those entities work together and where we can leverage change in any of those.
Great. My guest is Ann Christensen. She's the health director for the North Shore Health Department. I forget the title you used. It's a sub-county health department. We're talking about public health. And Ann, you talk about issues that basically would have you involved in everything from Do you smoke? Do you drink? You know, what are your personal health factors to local zoning? How are streets laid out? Is it a walkable community? That's a huge waterfront.
Right.
How do you pick your battles? How do you decide, well, it's Monday, March, whatever,
Sure.
we're going to work on this?
Right. Great question. So in any given day, there are things that we have to do. They're driven by state statute. So communicable disease investigations, prevention and control being really one of the basic functions that we serve. So those are the things that really, we're doing every day. And then there are things that happen that are focused on community health assessment and community health improvement plans. And I'll talk about what those mean in a minute. And those drive the priorities for the other elements of what we do. So yes, we could focus on everything and be very broad, but not very deep on any specific issue. But where the priorities come from should and is more and more driven by what the community is interested in. So as an example where I am, pedestrian safety becoming one of those issues that parents, teachers, schools, the residents are really caring about. So we've got an initiative happening right now in Shorewood where we're looking at modifications around some of the schools to reduce excessive speeds, traffic, so people are being mindful of school zones. So what can we do focusing on this specific issue, knowing that there are 100 other issues that we could be tackling, but this is the issue the community is asking us to address and to be part of a team of people that can address the issue. So we don't do this alone. That's the other thing to make note of. We work in partnership with other groups, be they other government agencies. For example, in the case of the Shorewood pedestrian safety, we work with the Department of Public Works. We work with the village government leaders. We work with Safe Kids as a coalition in the region focusing on injury prevention. So we're working with partners, again, to prioritize the issues, but also to prioritize what are the interventions that we're going to do to make a difference. So yes, we could tackle very many issues, but we really try to focus on, again, what those community priorities are.
And that's, I guess, to me, that was unexpected. When we talk, and when I read your article, which, by the way, excellent article on what public health departments do in the March issue of the municipality, you get the sense that at the federal level is where these sort of big picture priorities are set. But do you actually get into, at the local level, let's make a plan for the North Shore communities? Sure. So basically there's more buy-in at the local level?
Exactly.
What does that process look like?
So it looks similar and different no matter which community you're in Wisconsin, but we're charged with starting with a health assessment, which looks broadly at we collect a lot of data. So what are the data that tell us what the areas of, or what the health issues are in the community. So for example, we, in our community, use that county health rankings model, which I just talked about, of what are the health behaviors. So how many people, what's the percent of the population that smokes? What's the percent of the youth population that smokes? What's the percent of the population that drinks excessively, 5 or more drinks at a time? So we look at all of the data that we can pull together, and then we share that with the community, and we have a discussion with the community about, okay, these are the health conditions, this is where we might be doing better than the state or our peer communities, this is maybe where we're doing worse. And then we have a conversation about what those priorities are, and we pool that together and say, okay, what are the top priorities? It could be 3, it could be 5, and then we work to create a plan. Again, as I mentioned, partnerships with those partners to create a comprehensive plan to address the issue. Now, the health department could lead some of those initiatives, but we may not. There may be other groups that are in a better position to lead initiatives. Another example is we work with a coalition or an agency called RedGen in the northern Milwaukee County area, and they're focusing on mental health issues, really trying to go upstream, looking at wellness, coping for kids, redefining success for youth so that there's less pressure for academic success on youth. So this is an area we know our communities are interested in. A lot of communities around Wisconsin are focusing on, mental health broadly define issues, because we know suicides are up in a lot of communities. We know that kids are turning to substances, be it alcohol and drugs, to help with their coping strategies. So we're not necessarily going to lead those initiatives, because we have a group like Red Gen who is in a position to do that. However, we're going to be a supportive team member. We're going to be part of their leadership group that's focusing on this issue. But again, we're not necessarily the ones leading the initiative. So that's how it can work in many communities. Health departments can take a lead, or health departments can be part of a broader team where another agency or individual is a leader.
So you talk to your peers around the state, with their 80-some
Right.
local health departments. Are the issues the same wherever you go?
No, not necessarily. You see and hear a lot of common themes. Again, the ones that are coming up right now, I mentioned mental health is a top concern for a lot of communities. Certainly opioids, which we haven't talked about, but I would put that in a category of broader substances, alcohol and drugs being a topic that is on many communities' minds. But there are going to be local issues that are not going to be the same. You know, you mentioned lead poisoning. I think that's an issue around the state for sure, but it's very much a concentrated issue in the southeastern region of Wisconsin right now, given the infrastructure and the age of our housing stock in this area compared to other communities. So that may not be picked up on by, you know, communities in, say, central or northern Wisconsin.
And let's want to talk about alcohol, want to talk about opioids, want to talk about lead. So let's start with lead. The league worked on legislation that would allow local utilities, water utilities, to use ratepayer funds to help replace some of the laterals out there. From a public health perspective, for decades, we've known these lead pipes are in our homes, okay? This is not surprising. It was the way you built houses 75 years ago. From your perspective, is it safe to have those there, or should they be gone? Should they all be gone?
We look at lead poisoning and lead risk from a pretty broad perspective. So the laterals and replacing the laterals is one element of what is contributing to lead poisoning in a community or a specific community. Focusing solely on that will not in and of itself address the problem. Backing up to paint being really what we see as the driver of the cases of lead poisoning in our communities, certainly North Shore. So I think to focus on one specific lead risk area is not going to fully address the issue, because even replacing the laterals, you're going to still have many homes with lead fixtures inside the homes. And again, back to the lead paint being a really significant contributor, and not to discount soil outside the home can also have high levels of lead. So looking at all of those risk elements together, that's where we need to be much more comprehensive, going back to tobacco, where tobacco was quite comprehensive in looking at all of the different areas where we're getting exposed to lead and addressing those. So it's a broader issue than I think what we've been talking about recently. And I think it's critically important that we keep focused on the discussion about all of these risk elements, because one of the things that we're experiencing now is confusion amongst the public about what to do if they have, if they have risks. So as an example, we had somebody with a slightly elevated case of lead, so not between 5 and 10, and we went to the home to kind of check on conditions, and she had been told or heard through media to flush her faucet, so she had been collecting that water, boiling the water, and using that as her water for the day. And that's a message that is not what anybody would recommend, because boiling water actually concentrates the lead, so she was actually creating the opposite problem. So I think as a region and as a state, we need to think about our messaging about lead, and what are the kind of key things that people can do and really work to alleviate the confusion that's out there right now. So just the messaging being, lead paint, and there's some simple things to do, but there are things that people need to do. So one of the places where we see poisoning are the windowsills, raising and lowering windows, if there's any renovation. So wet mopping windowsills makes a big difference. So the dust falls into the windowsill, and kids love to hang out there. And that's where they get a lot of exposure. Again, I'm talking specifically the communities that I work in, but I suspect, more broadly. So wet mopping those windowsills. In terms of water, flushing water, so you get the coldest water, so you're pulling it from the main,
Right.
makes a difference. Using a filter if you're concerned, or if you're, if you've got an infant who's formula fed, using a filter that you change regularly, that's a message that's confusing for people too. Those filters have to be changed on a regular basis, and the filters have to be specific for lead removal. Again, that's a message that I think people are confused about, what filters work. If people are wanting and feeling the need for filters. So there are a lot of messages that I think have been confusing out there for people on the issue of lead poisoning.
And we could spend a lot of time
Yeah.
there, but there's a lot of things I want to check in with you on. Alcohol. I guess I sort of take it as a given that that's still pretty much our drug of choice in this country. Do you see, as a community health challenge, our attitudes toward alcohol improving, getting worse, not really changing at all? Where are we at?
That's a great question. I don't see a lot of change. So Wisconsin as a state has been a pretty alcohol-rich state for many years. We're still at the top of, indicators like percent of the population that binge drinks 5 or more drinks on any occasion. I don't see a lot of discussion around that happening at a state or local level because of sort of the, how ingrained alcohol is in our culture here in Wisconsin. There are places, though, La Crosse being a great role model and example for communities that are addressing the issue. They had a number of drownings in the river down there, and they put together a robust coalition 10 plus years ago to address the issue, and have made some great strides in their culture of risky drinking. Specifically, one of the things that they had been focusing on a few years ago is looking at their festivals, and looking at even things like the size of the glass offerings for people.
Sure.
And realizing, we can make a difference. We don't have to eliminate alcohol use, but we can make a difference if we just make glass sizes smaller for people, so that we're not filling 16 ounces, but we're filling 8 instead. So those are things that we can do that keep our culture of enjoying alcohol responsibly, but maybe being thoughtful about how much we provide people in any given serving or service time.
And is that an example, let's say for your peers, I don't want to put you on the spot
Sure.
directly, but is that an example where you have a little bit of push-pull with your community? And you have to, as the health advocate,
Right.
you have to advocate for responsible use, and without being the killjoy in the party.
Yeah.
And I speak from some experience
Sure.
with some of my own organizations. You can only push so far.
No doubt. But I think oftentimes it's just a matter of enlightening rather than pushing. So again, back to the serving size, when you bring that to people's attention, like, hey, why are we promoting 16-ounce glasses that have unlimited refills of beer? Can we think about an 8-ounce pour instead? Those are things that people come around to realizing, that really doesn't make that much difference for us in terms of the image and what we're trying to promote here. So we'll go along with that change. And that, another example, actually back to La Crosse, is they created a family zone for one of their festivals. So it's a non-alcoholic space for families to be. So that the whole environment doesn't have to necessarily be alcohol. You can carve out spaces where you're still having the fun and still having the event, but it's not all driven by alcohol, as an example. But you're right, it's a push and a pull between kind of what we accept as norm and what we would want to see differently.
Sort of our aspirations. And
Right.
yeah. My guest is Ann Christensen here on The Local Perspective. talking about community health, public health, opiates, did that one sort of catch you by surprise, or did you see that coming as a public health threat?
Again, I always give a both answer. So I worked for many years at the Injury Research Center at the medical college, so kind of keeping our finger on what are the injury-related issues that are rising up. So we've been focusing on the leading causes of injury, so falls, motor vehicle crashes for many years, then falls. And then we started to see the rise in poisoning-related fatalities, and I would say that was everything's 10 years ago, so about 10 years ago, where we started to see this shift and these indicators that are changing. And so that's my first kind of moment of seeing there's something going on here. And then as more we look in the data about what are those poisonings, what are contributing to those fatalities, and seeing that they're being driven by, prescription medications, heroin, morphine. Those are the poisonings then that were contributing to those fatalities. So on a data level, we started to see it, and then kind of experiencing it much more in the community as a surprise of, this is why these deaths are happening. It's because people are overdosing on these substances. So I think it kind of started slowly with the access to opioid prescription medications, and then has kind of snowballed as people have become addicted to those, seeking other drugs in other places, cheaper drugs, and having to go on the street for those. And drug dealers are not always forthcoming about what they're providing you, and so we're seeing
Surprise.
heroin and other illegal substances laced with all sorts of products, fentanyl being the one right now that's really contributing to the fatality rates that we're seeing.
So when I get together with mayors and village presidents, when they start talking about this crisis, there's not despair, but no one's found the silver bullet.
Right.
What are some strategies at a community level work for awareness, for actually reducing the amount of abuse that's taking place?
Well, it really starts again in partnership with the providers, and the prescribing habits of providers need to change, so that instead of getting 30 pills in a root canal or some oral surgery, you're getting the few that you need, so that there's not excessive medications. And police departments around this area have really stepped up to be places where people can deposit their excess medications. So that's one kind of easy fix. Let's get the medications out of the home so that people who are addicted, be they youth or older adults, middle working age adults, aren't having free access to those medications. So that's one kind of immediate thing to do. Second would be to look at, and we've been talking a lot about mental health, but mental health services, addiction services for people who are finding themselves addicted to these medicines, and before they move on to the illicit substances. So let's get them into treatment so that people can wean off of the substances and again, not end up with the illicit substances. So those are two kind of elements that we can do. But if you recall, drug use as a topic has been a challenge for public health for many years. And this challenge, while the lethality of it is certainly there, but the challenges are still there. And they go back to what I mentioned earlier of why are people initiating drug use in the first place? Obviously experimentation for youth, but then those substances give people feelings, they create addiction. So it's important to go back to the prevention strategies in the first place. And as I mentioned, wellness and stress and coping, and having people understand the elements in their lives that they're struggling with, so that they can make choices that are different than going to alcohol and drugs for that relief.
Great, and we've run out of time.
All right.
Ann, thank you very much for being here.
Yeah.
Ann Christensen is the Director of North Shore Public Health Department, talking about community health. I want to thank the West Allis Community Media Station, John and Dave behind the cameras, also Wisconsin Community Media. This is The Local Perspective, and I'm Jerry Gashane. Have a great day.
This is a really neat idea.
All right, good evening, ladies and gentlemen. We are going to call our December 3rd meeting of the Common Council to order. Before we take roll call, I just want to quickly explain to our viewers why there are 3 times the number of people up here tonight. We did our first student government night with our West Allis Youth Commission. So behind myself and the Common Council and our clerk are various members of the commission. We tried to sync them up as best we could with their representative from the district that they live in, but some of them were rather wayward and didn't have a home. They lived in New Berlin or Milwaukee, but we're all up here. They're here to observe. So thank you for being here, and we hope that this is an interesting evening for you. That being said, I will ask our clerk to call the roll.
Alderperson Rote. Here. Stefanski.
Here.
Vitale.
Here.
Weigel.
Here.
Barzak is excused. Shapleski. Here. Haas.
Here.
Lysick.
Here.
May.
Here.
And Reinke.
Here.
That's 10 present.
Okay, a quorum is present. Please rise and join us in the Pledge of Allegiance, which will be led this evening by Alderman Dan Rote. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, we are going to move on to item D on our agendas this evening, public hearings. We have one public hearing this evening. I will ask the clerk to read that.
Resolution to confirm and adopt the report of the city engineer containing the schedule of proposed assessments for improvement of West National Avenue from South 76th Street to South 82nd Street and portions of intersecting streets by concrete reconstruction, sidewalk repair, driveway repair, widening, narrowing of pavement, storm sewer relay, sanitary sewer relay, water main relay, building services, utility adjustments, and storm under drain.
Thank you. Mr. Daniel.
Thank you, Mayor Devine. Okay, this is the public hearing for National Avenue, as he said. Here's the procedures we're going to follow. I'm going to talk about the scope and the costs, and I'm going to talk about the assessment rates and methods of payment. Then we'll have a time for comments from citizens and council members. Then the project will go down to the Public Works Committee for discussion and possible vote, and then it would come back here to the full council for a final vote. Here's the project limits that we're talking about from 76th Street to 82nd Street. So 76th Street would be open at all times. It's not going to be affected by this. This is a aerial photo taken from 1949 that shows the 1941 brand new concrete pavement that was installed. That concrete pavement is still underneath there. It's still there 78 years later. It's still in service. So then in 1986, we came along and it didn't look so good anymore, so we resurfaced it, put new asphalt over the top of this concrete. That's still the 1941 concrete. So that asphalt that's over the top is now 33 years old and doesn't look so hot. So this is what it looks like now. We have severe pavement deterioration. This is what we call alligator cracking because it looks like the back of an alligator. Here's some more pictures. DPW has tried to fill the cracks, but there's too many cracks to fill anymore. So routine maintenance is very difficult, very expensive. And not only the road, but below the road, the sewers are in disrepair. We're going to put in a new water main. The existing water main is from 1906, so that's 113 years old. That means that is the original water main that was put in when the city incorporated, and that water main has never been replaced until now. We'll also be replacing new copper water service pipes up to the lot line, getting rid of some of the lead that's in the water services. We're going to put in some new storm sewer and then laterals to each of the properties. The storm sewer's from 1940, what there is of it, and that means that's about 79 years old. We're going to put in new sanitary sewer. The existing sewer goes back once again to the beginning of the city in 1906, so that's 79 to 113 years old. And then we're going to be replacing all the light poles with a new lighting circuit, electrical circuit, and light poles as well. We did do a traffic study on this segment. What we found is that there's about 14,000 cars a day. There were 25 accidents on this segment over a 5-year period, and 10 of those did include injuries. So that's very bad. But the crash rate is actually below the statewide average. Nevertheless, we're going to make improvements. 2 of the 25 accidents did involve bicycles, so we're hoping that the green bicycle lanes would help improve safety for bicyclists. And then we're also putting out the bump outs at the intersections, which should shorten the distance for pedestrians to cross and should improve safety for pedestrians as well. We've been working over the past couple of years on the whole National Avenue corridor plan. There have been 5 meetings already. The first one was when the corridor was adopted in 2015. The council approved it in 2016. Then for this specific phase of National, we've had 2 meetings already in 2017, 2019, and then we have the meeting tonight. And then there'll be one more meeting in February of next year to talk about detours and phasing and just the specifics of what's going to happen during construction. So we'll have a neighborhood meeting in this room that people can come and see the details on detours and so on. The finished project will look very much like the one that we did, the two phases we've done from 70th to 76th and from 92nd to 95th. With the brick terraces, the trees, the green bike lanes, the landscape areas, benches. Here's some pictures of those things. So very similar streetscaping, landscaping, decorative lights, trees, green bike lanes. Here is the cost of the project. It's about 3.9, almost $4 million. So $2 million of that is the pavement. The streetscaping, all those decorations I talked about are about $500,000. Street lighting's $156,000. Sanitary sewer, $370,000. Storm sewer, $425,000. And then water main, $409,000. The funding for this is mostly coming from the federal government. We got a grant that's covering 51%. Then the general fund, which is the citywide property tax, is paying 21%. The special assessments that the property owners are paying is only about 5%. The sanitary sewer utility funds are 10%. That's a citywide fee. The storm sewer is being paid for with the stormwater funds. That's about 3%. That's a citywide fee. And then the water main is being built with the water utility funds, about 10% of the cost, which is also a citywide fee. So here's a sample special assessment for a 40-foot lot. The assessment rate is $62.21, so that comes to $2,488. There are a few people with driveways. If they do have a driveway, they do pay $7.77 per square foot in addition. The bills for this would not be mailed out until March of 2021, not 2020, but 2021. After the project's done, that following year we would mail the bills out. And at that point, you would have your option between a lump sum payment or a 5-year plan or a 10-year plan. If you choose the 5 or 10-year plan, there would be 4% interest. So here's what the payments would look like. The first year in 2021, it would be $348. That's for the whole year. And then in the 10th year, 2030, you'd pay $259 for the whole year. Why do we special assess? Well, we have been doing special assessments for over 110 years, even up to 100% of the cost in the past for a new street, because the property owners enjoy a unique benefit from having this improvement directly in front of their property. So state law has always said that they can be assessed because of that unique benefit that they derive. Now on this job, I already said that the special assessments are actually only 5% of the total cost. The assessment rate is $62.21 per foot for all residential properties anywhere in the city, no matter how wide the street is or how high the traffic volumes are or how high the actual bid prices are. Everyone is treated equally. So if you live on a little cul-de-sac that's only 30 feet wide, you still pay $62.21. If you live on a busy street like National with lots of traffic, you still only pay $62.21. There's no difference. For For over 110 years, Wisconsin law has allowed for special assessments, like I said. And there have been a lot of court challenges, and judges have, in over 100 court cases, ruled that this is a fair and reasonable method to recoup the cost of these projects. So it has definitely stood the test of time. Another reason we special assess is that it's the only way to ensure that tax-exempt schools, churches, charities, hospitals, county parks, utilities, railroads pay their fair share too. No one is exempt from special assessments, even though there are 430 properties in the city that do not pay any property taxes. And many of these tax-exempt schools, churches, hospitals, and county parks are very large properties that actually encompass about 28% of the city and only contribute to the city's costs through special assessments. Likewise, businesses, corporations, and manufacturers pay a much higher assessment rate to ensure that they're contributing their fair share because they have extra traffic and truck traffic. So their assessment rate is usually $77 to $93 per foot. So here's two cases in point. The West Allis School District is going to be paying $6,300 for the Dotke High School. And Jordan Lutheran Church is going to be paying $6,000 in special assessments, even though neither of those two properties pay any property taxes to the city. This is a map, like I said, of the 430 parcels that are tax exempt throughout the city. And if you add up all those colored areas, it is 28% of the city's land area that is not paying property taxes. So that's reinforcing the point I just made. And then this is a map. All the colored areas are properties that have paid a special assessment in the last 10 years. So at least on the east end of town, and here's our project, it's almost everybody. And a lot of people have actually paid for their street and their alley over the past 10 years. So I guess the point is everyone is paying their fair share. Eventually we will do the street in front of everybody and everyone will pay their fair share. So there are some people that are on corners on National. This is not unusual. We do charge on both sides of your property. There are 10,000 parcels in the city out of the 19,000 that do pay for more than one side of their property, so that's 55%. 3,400 parcels out of the 19,000 pay for more than one street, and then 7,400 parcels out of the 1,900 pay for their street and their alley, so that's what totals up to 55%. So if you do have a corner lot and you're being assessed for National and for the side street, we would take the measurement and that's the same assessment rate, 6221. So that comes, in this case, $7,400, but then we take 60% off. So we subtract $4,400 going back down to $2,900. So 60% off on the long side of your property. Some people ask, why do I have to pay interest? Well, the city is borrowing the funds for this project. The city pays interest to these municipal bondholders over the next 10 years. So the city is merely passing along these interest charges to the residents that choose the 5 or 10-year plan. The city is not making a profit off of that interest like a bank would. Here's some particular schedule information for this particular project. So you probably have already seen that We Energies and AT&T are out there right now. They're putting in a new gas main like that, and they're putting in new conduits for AT&T. So they're going to be working through December to tidy that up. On December 10th, WSDOT is going to advertise for bids. This is a state project. So they're going to advertise for bids, and then on January 14th, WSDOT will award the contract to the low bidder, and we'll send that contract to Governor Tony Evers, and he will sign the contract, and then the state, I guess the point of the state does not get to pick the contractor. It will be the low bidder, whoever that is, and the city does not get to pick the contractor or the state inspector that is assigned to that job. That is all taken care of by the state. We hope to start work on April 6th if all goes well, and then we hope to be done by October 16th if all goes well. That would encompass 107 working days. That's outlined here. There's 4 phases that you can, or 5 phases that you can see here. So while there's 194 days from April 6th to October 16th, we're assuming only 107 of those days would be working days. And I'll explain that a little bit more here. So the work would take 107 weekdays out of the 194 calendar days. That's 55%. The state contracts do not require the contract to work overtime or on weekends or on holidays. So that's 57 days right there that they won't be working. Or at night, or when it is raining, and we're assuming about 30 days of rain over the summer. Since this, if we required that, it would dramatically increase the price of the work, and we're trying to keep our prices down. Furthermore, 50 of those 107 days, or about 47%, is going to be work that's taking place underground, so it won't really be visible to the casual observer. So if you come home from work at the end of the day, you may only see changes to the project site on about a third of those days because the work that they did that day would have been buried and you wouldn't be able to see it. Likewise, the contractor will have work. Most contractors have work in other cities. So if they have to make up time, maybe they would work overtime to keep up with that October 16th deadline, because they know that if they go past that, they will have to pay $2,000 per day to get if they don't finish by October 16th. So this is all calculated based on the work. Like here, water main, 2,000 lineal feet of water main is what we're installing. They can lay about 150 feet of water main a day. That translates to about 14 days. And all the way down, if you figure out how much work, how many days, that's where we come up with the 107 days. So, a little more information on state contracts. The state contract states that the contractor is solely responsible for the means, methods, techniques, and sequences and procedures. So the contractor is in charge of his schedule. The city is not directing them. The city is not working or performing as their foreperson, not working as their foreperson. We're not directing them what to do on a daily basis. The contractor is responsible to do that work. The state does have a performance bond and a bid bond as well to guarantee that the work is done. So we do have insurance that the contractor doesn't meet the deadline or get the work done. And the state would have the ability to disqualify a contractor from bidding if, according to their rules, there was fraud, collusion, criminal offense, or any violation of state or federal statute. So that's a decision that would be made in Madison by the state as to who's qualified to be a bidder and who's not. The city will not have any say in that matter. Here's the detour that we're proposing. You'll be able to go up 84th Street in Greenfield and back down 76th Street. Fairly simple detour. I want to stress that the road will not be done by State Fair on August 6, 2020. But National Avenue is planned to be open in the westbound direction only before State Fair opens. So the hope is that people will be able to circulate, like I'm showing here, from the side streets to if they're looking for parking, they can circulate in the westbound direction. They will not be able to go eastbound during the fair, but they should be able to go westbound. So we're hoping that that will alleviate some of the congestion and allow people to circulate looking for parking. But it will not be completely done before the fair starts. It won't be done until October. For people that do park on National, there would be parking on side streets. You don't need a permit to park on the side street. The police would be understanding, and they would increase patrols in the neighborhoods. If you are disabled and have one of these stickers or plates, we can make arrangements to have disabled parking spots on the side streets that would be close if you need help or closeness for walking. We can take care of that for anyone, so just let us know. And I want to conclude with saying that we do have weekly construction and progress reports that you can sign up for. You can subscribe to get our emails or text alerts, and they would send out weekly updates on this project and all of our projects next year. So with that, I will entertain any comments or questions from the council or the audience.
Thank you for the presentation, Mr. Daniels. Are there any questions from the members of the Common Council on this public hearing item?
Fine. I have a few
Alderman Stefanski.
I have a few questions. One is, how many actual homes on National Avenue are affected by this?
I think there's only about 4 single family or
4
duplexes.
Heritage Senior Living is the only place that's going to be accessible to them 80th Street?
we're going to do the construction in segments. So we're going to do from 76th to 79th Street first, so that people can come in from 84th Street. So we'll do 3 blocks, and then we'll flip and we'll do the next 3 blocks. Kind of centering around the gas station there, so the gas station will always have access. So for part of the time, they'll be able to get into Heritage the way they normally do. It'll just be a month or two when we're working right in front of them that they might have to come in off of 80th. It's something that has to be played day by day. I mean, we could probably scoot across at 78th Street to get them into that driveway as well, and then scoot them across to 79th Street to get into that driveway. So day to day it will change, but we're doing it in segments this time. We're not going to do the whole thing all at once. So for at least part of the time, they'll be able to get in the way they normally do.
2 more questions.
Sure.
Are we guaranteed by the state that Cornerstone will not be doing this project?
The state will have to decide if they disqualify them. I submitted information to the state on my opinion, and they will consider that, but the state will make that decision in Madison. I cannot guarantee that.
And the final question is, if they go past the date of October 16th and they're fined daily $2,070, does the city get any of that money to help the businesses that are affected by that?
No. That money goes to pay expenses for the additional staff time that is incurred because the project is now going past the deadline. So no, that's not something that we would do.
Do we have any grounds as far as the city's concerned to be able to do something about it, businesses that are affected by it?
Well, we've always helped the businesses with signage, and there are weekly meetings, to meet with the businesses to coordinate access, like I was talking about, on a day-to-day basis. I guess we've paid for the signage to direct people to, like the gas station or whatever business is in there. So we can help with that to get them in.
Thank you.
Any other questions from the Common Council?
Mayor Devine.
Alderman Weigel.
Pete, I have a question and a comment. So you're going to do, I'm not going to say you're going to do it in stages, because this is in the city of West Allis, and I guess this is my comment. This is a state project. It happens to be in our city.
Correct.
So in reality, there should be an engineer from the state here giving this speech.
Well,
right?
Correct.
And answering these questions, because it's a state-managed project
correct.
in our city. So that was the comment I wanted to make. But back to that, doing it in phases. So you showed that detour. There will be a time when people will still be able to drive eastbound on National Avenue from 84th Street. Because you start on the 76th Street end.
We don't know where they're going to
We
start.
don't know. That's going to be up to the
That'll be
contractor,
decided.
right? So where they start is going to be up to the contractor, right?
Right. Like I said, they're going to do 3 blocks at a time. We're not going to try to do the whole thing so that people can come get in from one end and then come in from the other end. So I think each phase is about a month and a half. So there'll be a month and a half where access will be difficult.
And so for that month and a half, when it's in front of someone's business or home, the street's going to be completely closed.
That's why I say day to day. I mean, if they're putting sewer in on the far end, they might be able to scoot in.
You might be able to drive in and drop off your groceries or get
Right.
a couch delivered or
Right.
something, but we're not going to be able to count.
It's not black and white. Not black and white.
Thank you.
Thank you, Alderman Weigel. Any other questions from the members of the Common Council?
Mayor Devine.
Alderperson Reinke.
These have to be qualified contractors, from what I understand.
Correct.
Do they have to live in our state to be chosen? Or can they live any place?
They can live anywhere, I believe. Yeah. There's no requirement that they live in the state. No.
I would take for granted that the state would have certain criteria that they choose these contractors for.
It's pretty loose, unless they've broken the law. I'm not aware, the only cases I've ever heard of where they were disqualified is where they actually broke the law for collusion. James Cape and Sons and Vinton and some other firms were actually colluding together, and that's one of the few cases where I can think of where the state actually disqualified someone. So they have a pretty high bar for what they choose to disqualify somebody for.
All right, thank you.
Thank you. Any other questions from the Common Council? Okay, seeing none, are there any questions or comments from the members of the audience? If you could come up to the microphone, please, and give us your name and address.
My name's Mike Hottinger. I'm not a resident of the city, but I own two buildings actually in this corridor. And my question would pertain to, with this project, side street parking is going to become key, and I think it's going to be in high demand. On 78th Street, as it butts up to National, on the west side of that, currently there's a no parking sign that goes kind of from National to, let's say, the entrance of the playground for Dotkey. Is there any way we can, because I would say there's probably a good 15 parking spots that can be picked up there.
It's a good idea. Yeah, we can look at that. Sure.
Okay, that's all I have.
Absolutely. Okay.
Thank you.
Thank you. Any other questions or comments from the members of the audience? Any questions or comments from any of the members of the Youth Commission? You all want to be engineers now, don't you? Okay. Seeing none, we will close our public hearing, and we will move on to item E on our agendas, which is citizen participation. This is the opportunity for members of the public to address the Common Council and me on any issues that are of importance to them. We do keep this portion of the agenda to 30 minutes, and we ask that you keep your comments to 5 minutes. Is there anybody this evening that wishes to address the council under citizen participation? Seeing none, we will close citizen participation, and we will move on to item F, which is the announcement of our recess committee meetings. The room numbers for our standing committees are listed on the top of page 2 of your agendas. I'll move on to item G, the mayor's report. I want to quickly congratulate, we have a new coffee shop in town. Alderman Weigel and I helped welcome them. They are at 1205 South 70th Street in the school district building. Vita Coffee Shop. They are hoping to have sandwiches soon, but right now they have baked goods and Houseplant Coffee. It is run by a group of students through a program through Marquette University. And then I just want to remind everybody about all the holiday events coming up this weekend. On Friday and Saturday, we have the Chris Kindle Market at the West Allis Farmers Market. That's Friday night and Saturday during the day. On Saturday afternoon, we have the tree lighting and the parade through our downtown. And on Sunday morning, there is a pancake breakfast put on by the West Allis firefighters, benefiting a couple charities, and that's at Station 2, which is on 67th Place. That starts at 8:30, 9. Starts at 9. So there's a lot of information, a lot going on this weekend. I believe the Historical Society also has their open house on 84th and National on Sunday afternoon. So it's going to be a busy one, a lot of people buzzing around. That concludes the mayor's report. Do we have any reports from the alderpersons this evening?
Mayor Devine?
Alderman Weigel.
Thank you. In the past, I think most of you heard me talk about the dog park project that we've been working on for like the past 15 months. I'm very proud to announce that we've finalized the date for the ribbon cutting and the grand opening. It will be 11 days from now on Saturday, December 14th at 10 a.m. If you're not familiar with where the dog park is, the main gate that's going to be opened first, which will be at the ribbon cutting, is on essentially like 112th and Hayes. So if you can picture where Rogers Memorial Hospital is on Lincoln and 111th, go south from Rogers around there, Hayes dead ends back there by Lincoln Contractor Supply. There's no dedicated parking lot there yet. That may happen in the future, so it'll be on-street parking. I'm sure the mayor will be there. We're trying to put together a little bit of an event. So the dog park will be free for the remainder of the year. Dog park for a month. And we're still exactly settling on what the fee is going to be for next year, but there will be a discount for West Allis residents. The dog park will be open from dawn to dusk, essentially, 365. a project I've kind of shepherded through, and I want to thank all of the volunteers that helped, staff, the other aldermen that have helped. Businesses really stepped up. West Dallas Community Improvement Foundation all helped. And again, we're glad to see that this is coming to fruition now. Thank you.
Thank you very much. Any other reports from the alderpersons?
Mayor Devine.
Alderman May?
I just want to let everyone know that this coming weekend, actually this Thursday, Friday, and Saturday at 7 p.m. at Hale, Frozen Junior is going to be put on by the Lane Patriot Players, and there's a certain alderperson who sits over there whose daughter is one of the stars of the show. My daughter is also a star in the show. So anyways, it's a lot of students actually from the 3rd and 5th District who participate in that. They've been practicing since September, and we'd like to see full audiences. So 7 p.m. this Thursday, Friday, and Saturday. And lastly, I know Alderman Barzak's not here, but I wanted to wish him a happy birthday. Thank you.
Thank you. Any other alderpersons' reports?
Mayor Devine.
Alderman Lysick.
I move for approval of the minutes of the Common Council meeting of November 19th, 2019.
Second.
There's a motion and a second. Are there any changes or amendments to the minutes? Seeing none, all in favor?
Aye.
Anyone opposed? The minutes are approved. I'll move to item J, items not referred to committee. I will ask for a motion to place item 3 on file and send items 4 through 7 to the city attorney.
So moved.
Motion by Alderperson Reinke, second by Alderman Weigel. All in favor?
Aye.
Anyone opposed? Motion carries. Moving to item K, our standing committee reports, license and health, Alderman Chaplesky.
I will be reading those out after recess meetings.
Thank you.
Mayor Devine.
Alderman Lysick.
I move that we stand in recess until conclusion of the committee meeting.
Second.
There's a motion and a second, and just so all the youth commissioners know, this is where we are going to break into committees in the room we were in for the social and for the regular meetings that we have, so you're welcome to attend those if either of that set looks appealing to you, or you're free to get out of here. All in favor?
Aye.
Anyone opposed? We are still in recess. in for the license and health discussion about the,
Well, we still can discuss the quota too. Well, that 51 we need to act on. I want to.
Okay, we ready? All right, we'll call the Administration and Finance Committee meeting to order. Point out to everyone that didn't just hear us talking, this is the Administration and Finance Committee meeting starting out. We usually start with License and Health. We're taking this just a little bit out of order to accommodate the other alderpersons regarding one of the issues that's coming before License and Health. So that was a long explanation. With all of that, all 5 members are present, and moving to item 22 is resolution approving the 2019 Engineering Department fund transfers.
Where are they? Mr. Chairman, where are they?
Alderman Chaplesky.
I didn't see him here.
There's a lot.
I'm sure he's
Yeah.
So the number is $23,700, and
It's much larger than that.
Much.
In the hundreds of thousands, like 800,000.
yeah, this is the wrong thing.
Maybe we don't have the file yet? It's 22.
It says 23.
Yeah.
It's another page.
This is about a transfer to TAPCO. It looks like it's for the
That's a
public.
payment.
Right.
And that
That's-
says Public
this is the-
Works. Here, flip this up.
And I thought it was that.
This is
It's for the Public Works Committee.
That's jacketed wrong.
So, yeah, this is jacketed wrong.
It should be number 22, right?
Yes, 22.
Yeah. Yeah, that's what we're looking at, 22. Okay. So let's hold 22 for a moment.
Okay.
And we'll move on to item 23, resolution relative to the agreement with the Village of Greendale for public health services.
Move approval.
We have a motion from Alderman Weigel,
Second.
a second from Alderman Rote,
Mr. Chairman,
and yes, Alderman Chaplesky.
we're not going to need any more staffing on this, or
No.
we can handle what we got?
It's a continuance of what we already have in place with them, so no
Okay.
change in staffing.
Okay, good.
Yeah, and Bob, so what services do we provide for Greendale? Is it their whole
Greendale,
health department or
Yeah, Greendale, it's largely environmental services.
environmental?
Yep.
Right, I did know that. Thank you.
Yep.
Okay. So, yeah, environmental services, going inspecting health, inspecting
Food,
restaurants
restaurants.
and.
Food, yep, food services, licensing. Periodically, any food complaints that we have that come to our attention, and it's really that extent.
Okay, thank you.
Mr. Chair,
Alderman Weigel.
remind me, Greendale's half of Southridge? Is it part of Southridge?
More of Southridge.
More of all of
Yeah,
Southridge?
just- yeah.
Thought the line went through. Okay, no. And then their little village down there.
Right, yep.
In a lot of homes. That's about it.
All right, yeah, any further discussion? All in favor, say aye.
Aye.
Opposed? Ayes have it.
Thank you.
And Mr. City Engineer, can you please come forward? Thank you.
Wording for
For item 22 is the 2019 Engineering Department fund transfers. We have the wrong jacket here, but can you tell us about it, Pete?
Oh, okay.
Thank you.
Visual, audio, visual.
Hi.
Basically, our bids were up 32% this year, which created some problems. I've been tracking this ever since I started here, 1991. This was the biggest rise we've ever seen. So it caught me off guard. I didn't budget for that. I think it's mostly attributable to Foxconn and WisDOT. WisDOT and Public Works, in April, May, we were seeing this trend. The other thing which I mentioned in the resolution is that I did not budget to outsource the street lighting. That was not in my budget at the time. I had no idea that it was going to cost 5 times as much to outsource it. So I did make some corrections in May, June, canceled 6 projects to try and save money so that we wouldn't hemorrhage too much. So that helped. But at least 10 of these projects, from the moment the council awarded them, they were already over budget because the bids were so high. So, I guess in the future I will try and cancel more projects if this happens, but I mean, we got to the point at the end of the year where there's nothing left to cancel, and I knew 116th Street was a very expensive job, and I knew it was very much needed. The street was actually closed, so that was deteriorating quickly, so that's how we got here.
And so this is a fund transfer. Where's the money coming from? We know it's going to engineering. Thank you, Peggy.
So the amounts, just so you have them, 788,000 in the general fund and another 363,000 in the water utility. So the water utility one obviously is gonna come from the ratepayers. We are processing a rate case right now. We will obviously build this into it, but it's gonna take us a while to recoup that. The $788,764 for the general fund. Thankfully, last year we put some money away with our year-end remainder funds, so we'll be able to absorb that through there.
Mr. Chair?
Alderman Weigel.
Pete, you mentioned Foxconn. So we're seeing this probably regionally around the Milwaukee, Chicago. So if we were like in Fargo, North Dakota, we wouldn't have anticipated this big bump. Well, except they probably have the oil boom. Yeah, oil fracking. It's supply and demand. Yeah.
We only had one bidder on National Avenue, the part that from 92nd to 95th. So I mean, and that bid was 13% high, and then they all, yeah, we had competition. I mean, I guess I will say too that this was the first year that we outsourced the street lighting, and I think a lot of the contractors were feeling uncomfortable because we'd never done that before, how that was going to go. So I don't know if that affected their prices. We'll find out this year because we unhinged the street lighting. We're going to do the circuits separately, and we're going to do the streets separately. Concrete contractors don't like getting involved in things they don't understand, like electricity, so that may have, upped some of the prices, I guess, because we were trying to do it all on a street-by-street basis. But, Foxconn was mostly doing street and sewer work in the spring, so it was the same contractors. Payne and Dolan was working for them. A.W. Oaks does work for us. They were doing work for Foxconn. And then WisDOT let, like a record, I think I read in the newspaper, it was the most contracts they've let in 10 years or something, so it was like $250 million. So there just wasn't enough contractors, and I don't think they're colluding with each other, but they do seem to have a general sense when the supply is low and the demand is high that they could probably get a little bit more money than they used to. So
labor.
And we're not expecting any relief for 5 years, probably,
the only
right?
thing I'm hoping, maybe if we unhinge the street lighting, that will rest, or give some rest to them. Foxconn's moving into a new phase where they're not so much doing our type of work, they're doing inside stuff. And maybe we won't be competing with Foxconn. I haven't heard of WisDOT. I don't think they're letting as much maybe as they did last year, so. If you look at my chart, actually, the previous 2 years, it had actually gone down. There was that year and that year where it actually declined. So, on average, if you were to draw a line, it's probably been about 5% per year, but it just all happened at once, which caught us off guard. So,
Have a copy of that.
Sure. Won't happen again.
It was a good
It's all right,
meeting.
we know it's all right, any other discussion? Can I have a motion?
Move to approve.
Second.
We have a motion and a second. Any further discussion? All in favor, say aye.
Aye.
Opposed? Ayes have it. And item 24 then is a resolution relative to transfer of $35,000 from the assessor, through the assessor.
Move approval.
Have a motion from
Second.
Alderman Weigel and a second from Alderman Rhodes. 3 seconds.
Sorry.
That was hilarious.
And any discussion?
Mr. Chair?
Alderman Weigel.
I just wanted to say, I think everybody saw the email that
Yes.
Jason sent explaining how it is and how we came to be here. And then this particular project, this reval, is actually under what was budgeted for it, so that's good to know. So.
Any further discussion? All in favor, say aye.
Aye.
Opposed? Ayes have it. Item 25 is a resolution relative to authorizing single source purchase for police K-9.
Move approval.
A motion from Alderman May.
Second.
Second from Alderman Weigel. Any discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. Item 26, a resolution relative to accepting sole source proposal of Municode.
Move approval.
A motion from Alderman May.
Second.
Second from Alderman Rote. Any discussion? Steve, please, come on down.
Sure. I don't know if Gail wants to jump in too, but I just wanted to give a little heads up that there's going to be a slight change that you're going to see with this particular thing. I think you had a copy of that ordinance or resolution.
I think I had it.
No,
Need this one right
This
here?
one?
Oh, the look of it?
Yep. So one thing we're going to be doing is using a system that's going to create our ordinances for us, and it's going to show what Kale wanted you to see is all the changes in red, and it's going to be nice. But the difference is it's going to be a PDF attachment to the legislative file, so we're not going to be using this part anymore. So I just want to alert you to that particular.
So more
change that
stuff to
you're
download and open every time I want to read it. Right?
But the biggest part of it is digitizing. So when we're creating the ordinances and resolutions, once it's done, we just send off emails to me and the mayor, and we digitally sign. So there's not going to be paper copies of stuff that's needs
So the wrong things won't get attached.
Yeah. There it is.
And on top of that, it's gonna make drafting way easier and simpler. It's gonna make the presentation of the changes way easier and simpler. Right now, it's a big hassle to try to even show any changes in ordinances, given the current system. So, the functionality of this one is significantly better.
The codifier is actually going to change. So right now you go in, it's general code that maintains our municipal code. This is going to be the new company. And once all the ordinances are done and adopted and published, we hit a button and it's automatically updated. So we no longer have to pay for supplements.
Which obviously is a problem because ordinances we pass, it will be a few weeks before they actually show up on the system. So
Or a few
it's-
months.
It can be a long time. So it'll be nice once that happens.
Currently.
'Cause the new system though will be the moment someone presses the button.
And you'll be using it for the policies and procedures also, so you'll be seeing them that way.
And I'd suggest it for council rules and the fee schedule as well.
Mr. Chairman?
Alderman Jabuski.
Okay, how soon is this going to be going up and
We're
running?
kicking off with some training coming up in the next few weeks, and then January 1, basically.
Okay, good.
Probably a little bit of an overlap between the two companies, so we'll make sure it's seamless flow.
Alderman May.
You mentioned something about the downloads. We're not going to be able to download them anymore? Or it's just going to be a different type of download?
It's just going to be like any other attachment within
Good.
the legislative file.
Okay, I just want to make sure this is all searchable through our website for anyone in the public who wants to find anything. Good. Thank you.
Any further discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. Item 27, resolution relative to accepting a sole source proposal Intech Software Solutions for elections planning and
Gotta keep reading till
administration
somebody
program.
makes the motion.
Yes.
I move approval.
Thank you. We have a motion
I'll second.
and a second. Is there any discussion?
Mr. Chair,
Yes, Alderman
can you
May.
explain how this works?
Sure. Right now, we have basically all of our election information, machines and equipment, supplies, poll workers, in several different databases being Excel spreadsheets. And this system is going to conglomerate that into one system that's linkable, manageable. It's got things like training functionality where we can put up videos and people can watch, so I don't have to bring in people for on-site training all the time. It's got work order stuff, so when I issue a setup for a particular polling site to the Public Works Department, they get all the data off of this. Right now, they keep their own like handwritten notebooks and stuff.
So the
For
people
community
working,
arts-
so the people working in the polls, how does this affect them?
They will get automatic. Well, the system automatically generates letters, emails, and it's even got functionality for text message reminders. Like the week before the election, you can send out a text message to them.
Okay, so when they're actually working the polls the day of, they're not going to have to touch this. This is all
This is all
you.
internal management.
Perfect.
Thank you.
Mr. Chair.
Alderman Chapesky.
Same question. When is this going to be up and running?
For the February election.
Okay.
Any further discussion?
There it is.
All in favor, say aye.
Aye.
Opposed? Ayes have it. Item 28, resolution relative to accepting the proposal of Vanguard Computers for a whole bunch, 60 desktops and 10 notebooks.
Move approval.
Motion
Second.
from Alderman May and a second from Alderman Weigel. Is there any discussion?
Mayor, jeez.
Yeah, I'll take
Promotion,
it.
dude.
Yes.
Is this all budgeted? Uh-oh. I like the yes from the crowd. I don't like when you stand and come up here.
It's a little more complicated than that.
Okay.
So, in IT, I'm Tony Warkachewski, Director of the IT Department. Every year in my general account budget, there's usually $50,000 put aside to replace PCs across the city. We have a 5-year replacement cycle. My 2019 budget, that money has already been spent. We do that usually in spring, and that gives us all summer and fall to deploy the new computers. Because of the budget pressures facing us in 2020 and working with Rebecca, we really tried hard to not put that $50,000 in next year's budget. And it's not in next year's budget. But when we looked at that harder, some of the concerns we had with not replacing PCs next year was the PCs that were due to be replaced are still on the Windows 7 platform. It's getting kind of old. There's 2 issues with that, really 3. Microsoft is ending support of the Windows 7 operating system. Those desktops have a lot of security vulnerabilities that Windows 10 is now fixed. And third, they're just really slow. So the 60 or so employees in the city that still have those old desktops are losing some productivity.
How many?
60.
Okay.
So in working with Rebecca and Peggy, I think when 2019 excess funds became available, we're kind of fast forwarding the purchase to use some money that's available this year to buy the PCs and get them deployed next year, but not using 2020 budget.
So it's carryover.
This was the carryover that was approved by the committee and the council.
I should have said carryover, right?
Yes.
Yeah. I'm sorry.
That's okay.
You could have said carryover from the seats.
Yeah.
Didn't want to lose my 5 minutes.
Thank you for
Good
coming
to know.
forward, Tony, and explaining
Thanks,
to me
Tony.
there. Yeah, and I think that's it. Thank you. Any further discussion? All in favor, say aye.
Aye.
Opposed? Ayes have it. Item 29 is resolution establishing health insurance plan funding. Yes, we're gonna hold this
Yeah.
for.
Act on this?
We're not gonna act, yeah. And we're having a meeting on Monday, and you see that in your agenda too, Monday, December 9th, Administration of Finance, special meeting at 6 PM.
It's a regular meeting.
Earlier,
Regular meeting.
it was 5:30.
5:30? 5:30 again?
And check my calendar, because somehow mine, I have 6.
Well, that might just-
We can do 5:30,
I can do
because
5:30.
I see nods for 5:30. And Mickey says no.
We'll see.
Oh, because you got to get out of work faster.
Talk to the
I
boss.
actually had 5 in my calendar.
Yeah, I did ask for 5 o'clock,
Yeah.
whatever.
I think,
So what is it?
right, I think 6 o'clock works best. That's our usual meeting time. That's for Alderman Chapleski to get here on time. I would like 6 o'clock unless somebody feels, okay. So, good. Yeah, 6 o'clock PM, that's Monday, December 9th. Okay. And then for items 31 to 34, can I have a motion to follow the city
30?
attorney recommendation?
30?
Thank you for correcting me. 30, 30 through 34. Can I have a motion to do what the city attorney recommended per our agenda?
So moved.
Second.
I have a motion and a second. Any discussion on that? All in favor, say aye.
Aye.
Opposed? Ayes have it. Anything else properly come before our committee?
Move and adjourn.
Second.
We have a motion and a second. All in favor?
Aye.
And then we're adjourned.
Okay, let's go to license of health to order. Everybody's here. First thing you have, number 50, Torrin Brown. Want to come up here? you're gonna take over the 1022 and 60th site?
Yes, sir.
Have you ever done this before?
Yeah, I was partnering with somebody in a different state, but not here in Milwaukee or
Are you familiar with the recent problem we had over there? Between two places?
No.
Okay, no, there was a big problem there. One of the things is that you have to realize that you're responsible for the people, not just in your premises, once they leave also. You know, because a lot of people, a lot of bars, what they used to do is just push the people out of their bar, figure they're fine, and the neighborhood has to absorb all the fights or whatever goes on. Well, you have to live with the neighbors, they don't have to live with you. So, is anybody else, Marty?
Mr. Chair?
Alderman Weigel?
Mr. Brown, I was looking at your application. So you've been working for Primerica for like the last 12 years? And that was here in Milwaukee? Okay, and then you also had self-employed listed for the same time? And what was the nature of that?
barbershop,
Okay, and what'd you do for Primerica?
life insurance agent, investment, debt consolidation.
Okay, so for the last 12 years, you've been living in Milwaukee? Okay, but you said you had experience in the business somewhere out of state.
Right.
So that was previous to that?
I was just traveling back and forth. One of my partners moved to Atlanta, and I was just helping him out with his business that he got started.
Okay, and what kind of business was that?
It's a bar lounge.
Okay, and looking at your application, you put down you're gonna do 50% bar and 50% food. Is that what you did at the previous location? I mean,
It was a mixture of all that. It was like entertainment and everything as well. But this is gonna be more so like an upscale lounge, not like a club or anything like that. So it's more upscale environment, relaxation, appetizers.
I'm just concerned, because I'm in the business, okay? I have been for 39 years. I just don't see how in that location with that physical layout, grill behind the bar, that you're gonna do 50% food, right? And that just doesn't seem like a reasonable number to me, I guess. And then in the entertainment form, you checked off, you're gonna do live music and concerts.
No, it was a slash there, but it's not a big enough venue for it.
No, I was wondering about concerts, but you're gonna do live music?
Yeah, I'm gonna hope to,
Okay,
get
and,
like,
and you check karaoke? Okay, but you didn't check dancing, like, so you're not gonna, we have a dance hall license in West Dallas.
okay.
If you don't check dancing,
But it's not gonna be a dance floor.
well, it's not just about dance floor, but you're gonna have to tell people stop dancing if they start dancing. You
Might wanna check.
You might wanna revisit that, is what I'm saying.
Okay.
Okay, because, we expect you to abide by the plan that you're presenting to us, okay? So, and I guess, like, that checking out, that 50-50 split, that really concerns me, because that to me speaks to that you don't have a realistic view of what's gonna be happening in the business there. I think you're gonna be more like 80-20 or 85-15 bar food, you know, with 15% food. That's what I kind
But
of
the
see.
reason why I projected that, because I have another family member that like is trying to go into doing food, like for a restaurant.
Yeah.
So that's gonna be like the person that's over my kitchen area. That's
Yeah, there's no kitchen there though, is there?
It's a nice setup.
It's a grill behind the bar.
Grill, hood.
Is there's not a prep kitchen in the back or anything that I missed? There is? Okay, I guess I haven't been in there lately. Okay, so,
Yeah, the former owner that was there was doing food as well.
Yeah.
So,
okay. Okay.
so it's basically a business to help another business start.
Well, that'd be great if it was like an incubator kind of thing. So, we kind of give a little speech to all of our new bartenders. Are you gonna be working this, you keeping the Primerica job?
Yeah, I'm self-employed with that. I'm 1099 with them, so I'm anything.
Oh, okay, okay, so you're a contractor with them. So you're gonna keep that, so you're gonna be the hands-on day-to-day guy there?
Yeah.
Okay, so you're gonna be, I believe you're listed as the agent, you're gonna be bartending there also?
Yeah, I'm gonna have bartenders,
Yeah, so long hours, I get it. Well, I mean, you're familiar with the laws, you have to buy from licensed wholesalers, you understand that? There's gonna be a licensed bartender on the premises all the time. Actually, anybody working either has to have a license or be directly under the management of a person with a license. That can't mean in the back kitchen, that can't mean in the basement, you know, under their supervision. There may be an occasion when the police come in and do a compliance check with somebody under the age of 21 to attempt to purchase beverages, so you may face that. We also expect that there is a problem. If you just think you should call 911, you should call 911. We have licensed and trained professionals who'll come and solve your problems for you. And that's what their job is, so. And also, if that does happen, we want you to be cooperative, you and your staff to be cooperative with the police and help solve the problem and not go, oh, I didn't see anything, I don't know anything. That's it, Mr. Chair.
Mr. Chair, I'm looking, what was the former name of it? The Star? What was the bar before
The
that?
Broken Star is the one to the
The one
south.
down the block.
Yeah. This
The
was
Premier Club?
Premier.
Premier Sports
Wow.
Lounge.
Okay, that's why it's not, okay.
You know, I'm looking at your layout here, and, you know, the only food area you have here is all up front. You said that they prepared otherwise,
Yeah, it's like a prep kitchen.
it's all up front. Yeah, I've been in there once, years ago, and, which takes up about a third of the whole place. They said that a capacity of 80 people?
Yeah, I think so, 80, 82 or something.
You're not moving far if there's 80 people in there.
Right.
Is that what the fire department says? Or where'd you come up with the 80?
That's what the owner of
The
the
owner said?
establishment. She's run that particular location for like 20-some years before she like leased it out to other people.
Right, okay, well, you're gonna have the fire inspector in and everything anyway, so
Yeah,
they'll look all that, but, because I remember it being just really small.
Yeah, I mean,
area.
like right now, the reason why I know it won't be a problem because everything that was in there, like pool table, all that stuff, that's out. Everything else is gonna be couches, you know, cocktail tables, chairs, things like that. So it's not gonna take up a lot of space.
Okay.
Mr. Chair, just got a couple more quick ones to add. The licensed bartenders have to be licensed with West Allis, not another community. We've seen that recently, a bar recently opened, made that mistake. And with those police checks, if it happens, you know, twice within a 12-month rolling period, we have closed down bars for a period of time, 10, 15-day penalties. So just, our recommendation is just card everybody. So, thank you.
And the other thing is that where you're situated is no parking lot. You're on a busy street. Parking's always an issue. Make sure you're courteous to the neighbors. And you do have that other bar to the south, which also eats up. Fortunately, the one across the street never opened, you know, so there's parking there. So. Anything further? Do I have a motion?
I move approval.
Second.
Is there any further discussion? All in favor?
Aye.
Anyone opposed? Motion carries. Now, this
Good
will be-
luck.
Yeah, this will be voted on tonight by the rest of the council.
Best wishes.
Good luck. Next, we have item number 51. This is the ordinance authorizing some changes in our laws. Cale, can you kind of give a brief overview of this?
So what you're going to see is essentially what is also on your agenda, I believe, is number 55. However, it's been split up into two different ordinances. Based on discussions with Alderman Weigel, we felt that it would be most beneficial or efficient for the community to talk about these two things separately. So what's number 51 basically is making a change to the code that specifies general conditions that are always applicable to all licensees all the time. None of that is changing substantively, it's just making a few adjustments to make sure it's clear that these are the conditions that apply to every licensee no matter what. In addition to that, it's adding a subsection 12M right below 12, and that 12M is going to be what was discussed a couple weeks ago and earlier in the summer, which would allow the council to impose specific conditions on a licensee that only applies to the licensee if the council specifically assigns that responsibility. And in 51 here, 12MA is basically a restriction against use of the property, so it would require potentially a different type of primary business. This is intended to address places to avoid having only a bar. So you can make a tavern, you could just let it be that, or you can make a restaurant required to be the primary business. You can make a painting studio being the required business. You can make a hotel being the required business. So you can make something as a principal business. And that is established in state law what a principal business is. It talks about basically being more that than alcohol sales. The nice thing about that particular provision is it allows the council then, who is the fact finder and interpreter of the law during a quasi-judicial hearing, to determine whether it still is a principal business that the council ultimately assigned. So it's a good way for the council to maintain a level of control after a license is issued that otherwise you wouldn't have.
So, Mr. Chairman, for example, hotel someday decides they're gonna convert to condos with a lower level bar. We can say, nope, we gave it to you as a hotel as your primary business. You don't have a property right to that liquor license anymore.
It could be revoked as a result of this ordinance being passed and that condition placed on the license. It allows you to pull that license.
But they'd still have a property right, meaning that if we, to revoke that, we'd have to go through that quasi-judicial hearing.
Right.
Yep, and it has to be,
Dale mentioned.
you have to make findings of fact that relate back to it's the same process. It just creates essentially an additional
We have
mechanism that you could utilize during that process that doesn't exist otherwise.
Got it.
And if you don't care and you just want to issue a license and there's no restrictions, nothing requires the council to put any of these specific conditions on any one licensee.
Now, currently what we have in this year, what is the change going to do? What is the main thing that's going to enable us to do?
Under number 51, the only change is nothing changes automatically. What changes is that the council has one additional tool now to impose a specific condition on a licensee saying you must be primarily something other than a bar. But you don't have to do that with everyone, it just gives you the authority to do that. So a good example would be, a couple weeks ago, there was a painting studio or a print studio that was applying for a license. If the issue was you didn't know how long that particular business was gonna last, there's nothing in the books right now that allowed you to do anything with that. If you grant the license, they can use the license according to state law. But if you have this on the books, you could grant the license with the condition that it operates as a painting studio primarily. That way, if it ever ceases to exist as a painting studio, under that definition, the license could be revoked at that time.
Mr. Chair, if I could?
Alderman Weigel.
We see this all the time. People come in, and there isn't a recent case of somebody making an assurance it was going to be one kind of business and ending it not being. But we're talking about Reunion on Greenfield Avenue. It's going to be kind of a family-friendly bar with play area, sports and games upstairs and all that. And that's how it's presented to us, and we take that applicant at face value, and we believe he's going to do what he says. But without these teeth, he could, after 2 years, the family-friendly bar business isn't that good. We're going to put a dance floor in upstairs, throw in a band, and it could be something entirely different than what was projected to us. And this will give us the ability to require him, any applicant, to stick to what they put in writing for the application. This has nothing to do with the quota. This 51 has nothing to do with that. That's a discussion that we can have now or another time. But all this really does is give us and the entire council more authority to hold applicants to what they say they're gonna do.
So my question is, if, kind of like your situation, you talked about a hotel, if the person does change the business, are they allowed to come back and reapply for a different license that would change
They could ask.
what they're
They could
doing?
ask.
Ask for an amendment
Yes, so they could request that condition be removed from the license.
Okay.
or amended.
Yeah,
And
they could ask.
and we
don't
can
have
give
to
it,
s-
or we don't, and we don't have to do
But they
it.
still have the capability of
Yeah. Right.
resubmitting to us.
Something
Right.
to change.
Okay.
Business change.
Does any of the other alderpersons that haven't heard this yet have any questions?
And Mr. Chair, I just want to clarify, this is just 12, or 9.02 12M-A, correct? We're not talking about the other B through F yet, we're not talking about 9.01 yet, so just want to clarify that.
Okay.
Move approval.
Second.
Is there any further discussion? All in favor?
Aye.
Anybody opposed? Motion carries.
And, Mr. Chair?
Yes.
I believe we're holding item 52 where the broader discussion on the quotas, right? We can,
If you want to hold it, you can hold it. If you want to start discussion on it,
well,
we can do that.
I think we've had a discussion on this, I believe, already, right? I mean, I don't know that it's ready for a vote. I think there's probably some other element concerned about it. I think I'd be okay with holding as far as timing for the applicants that we have in process right now. I don't know what everyone else's thoughts are on it.
Let's hold it.
Well, we have everybody here now, so that's like, we can at least, except for Alderman Barzak.
Except for Alderman Barzak.
Right, which I'm sure is going to.
I know he's going to want to weigh
But-
on it.
Yeah.
so you finish, you have something?
No, Devin, yeah.
So one option two would be to not consider the quota tonight, but consider potentially the other conditions.
Yes,
You wanna
that's
add
what I was
to
gonna
license?
ask. That's what I was gonna
You can
ask
Do that
for.
as well, if you'd like.
Okay.
So, Mr. Chair,
Hold on, me.
and Kale, what that would look like is basically approving number 52 without the section 9.01 change.
Correct, you just, someone would move to amend to remove part one of the ordinance, and that would focus it only on the specific conditions.
And Mr. Chair, I'll make a motion to approve item 52, taking out section 9.01. And for those, I should probably wait for a second before a discussion. So for those who aren't aware, 9.01 is lifting the quota entirely. So I'm saying we're not taking that up tonight. The second part is additional things we can ask a licensee to do, such as security cameras, things like that as part of their application. So,
Yeah. And Mr. Chair, if I could do a little more in depth on that. So these, what we'd be talking now, for everybody who doesn't have the full text, is these would be restrictions that we could place, we could ask applicants to put on their license as part of maybe a possible revocation or suspension process. So if someone's operating a business and we're uncomfortable with the way they're doing it, they're having repeated problems with, say, minors or over-serving or unruliness, instead of revoking or suspending, we could say, well, you can stay open, but, and there's a litany of restrictions that we could put on. It could be require cameras in your business that are accessible to the police, and that you'd have to keep those recordings.
Operational.
Yeah, operational and for 7 days. Or let's say the place has a problem over serving. Obviously, over serving is already illegal, but sometimes maybe it's connected to how they price their drinks. Maybe they do all-you-can-drink specials, or maybe they're doing 3-for-1 happy hours or something like that. And you could say, well, you know what? You can either be revoked or suspended, or we'll let you stay open, but no more all-you-can-drink specials. So that'll be another tool for us to use. You know, again, not touching the quota, it's just giving us more authority.
Couldn't have said it better.
Mr. Chair, I guess I just want to clarify, these are optional restrictions that the committee and the council can put on,
Right.
not mandatory.
Right, these are all optional. Anybody else? I give a motion a second. All in favor?
Aye.
Anyone opposed? Motion carries. This is as amended.
That was,
I'm not writing it on here, but as amended.
I got it.
I don't want to mess it up. Okay, then we're going to hold item 55. Everybody wanted to hold item 55 instead of talking about? Okay. Okay, we have item number 53, musical license for.
Move approval. Second.
Any further discussion? All in favor?
Aye.
Anyone opposed? Motion carries. 54, various license. Do I have a motion?
Move approval subject to necessary requirements.
Second.
Any further discussion? All in favor?
Aye.
Anyone opposed? Motion carried. Then we have item number 56, operational license for Guadalupe Valdez.
Mr. Chair,
Oh, may-
if I recall this issue, the gentleman was going to show us his rehabilitation.
So I talked to Attorney Serwin about this. There was apparently a mix-up. The DAG is not going to be charging him with some pending issue. And on top of that, essentially Nick said that he did present him with some sort of, he's off probation. There's no further criminal proceedings against him or any type of, he's not in the system anymore. So our office would see no reason to deny this one.
Thank you.
Move approval.
Second.
Mr. Chair,
Any further discussion? Alderman May.
he was here earlier, wasn't he? Didn't I see him? Yeah.
I did see him. I think he left.
Okay. Well, he probably will be happy with the outcome anyways.
Didn't we tell him he doesn't have to?
We did.
We did tell
He
him
was
that.
here earlier. I saw him.
Okay.
Yeah.
Any further discussion? All in favor?
Aye.
Anyone opposed? Motion carries. And that is it. Motion to adjourn.
So move.
Second.
All in favor?
Aye.
Anyone opposed?
all right.
Good evening. We'll call the Common Council back to order. I will ask the clerk to call the roll.
Alderperson Rote. Here. Stefanski.
Here.
Vitale.
Here.
Weigel.
Here.
Barzak still excused. Shapleski.
Here.
Haas.
Here.
Lysick.
Here.
May.
Here.
And Reinke. That's
Here.
9 present.
We have 9. A quorum is present. We will begin with the Administration and Finance Committee, chaired by Alderman Haas.
The Administration and Finance Committee acted on the following items. Items 22 through 28 were adopted, and item 30 was placed on file, 31 was placed on file, 32 was denied, and items 33 and 34 were placed on file. I move for approval of the committee report.
Second.
We have a motion. We have a second by Alderman Weigel. Is there any discussion? Seeing no discussion, Mr. Clerk, please call the roll.
Alderperson Rote. Aye. Stefanski.
Aye.
Vitale.
Aye.
Weigel.
Aye.
Shapleski.
Aye.
Haas.
Aye.
Lysick.
Aye.
May.
Aye.
And Reinke.
Aye.
That's 9 present, or 9 yeses.
And present. Motion carries.
That's it.
Thank you, Mayor Devine.
Thank
That is
you.
all.
Next up, we have the Public Works Committee. Pinch hitting this evening for Alderman Barzak is Vice Chair Alderman Vince Vitale of the 1st District.
Take away the soapbox.
Mr. Mayor's Public Works, we met during the recess meeting, and we have 4 resolutions, item 35, 36, and 37, and 38. 37 was the Public Works presented by Mr. Daniel. I'm sure everybody see the explanation that he presented. He always does a great job. Mr. Mayor, I move of the approval of the recommendations of those 4 items. So at this point, I need an motion.
We have a motion and a second by Alderman Weigel, I believe.
Yep.
Any, that was the longest readout of 4 items I've ever heard in my life, Alderman
Sorry,
Vitale.
I like to expend myself. I like to expend myself.
Way to elaborate.
I know.
We have a motion, we have a second. Is there any discussion? All in favor? I'm sorry, Mr. Clerk, please call the roll.
Alderperson Rote. Aye. Stefanski.
Aye.
Vitale.
Aye.
Weigel.
Aye.
Shapleski. Aye. Haas.
Aye.
Lysick.
Aye.
May.
Aye.
And Reinke.
Aye.
That's 9 yeses.
Motion carries.
Thank you, Mr. Mayor.
Thank you. Next, we have the Safety and Development Committee, Alderman Lysick.
Mayor Devine, I refer you to items 39 through 44 on your agenda, various parking-related ordinances, and item 43 and 44 are resolutions. Item 44 is creating the Chris Hansen TIF number 18. Acted upon favorably by all 4 members of the committee. I move for adoption of the committee report.
Second.
There is a motion and a second. Is there any discussion? Seeing none, Mr. Clerk, please call the roll.
Alderperson Rote. Aye. Stefanski.
Aye.
Vitale.
Aye.
Weigel.
Aye.
Shapleski.
Aye.
Haas.
Aye.
Lysick.
Aye.
May.
Aye.
And Reinke.
Aye.
That's 9 yeses.
Motion carries.
That's all, Mayor.
Thank you. Next up, we have the License and Health Committee, Alderman Shapleski.
I'd like to report on items number 8 through 21, number 50 through 54, and number 56 on tonight's agenda. These are various reports, license and ordinances. 51 is as amended. They were voted for approval or to pass by all 5 members. I'd like to move for the adoption of the committee's report.
Second. There is a motion with a second by Alderman Rote. Any discussion? No discussion? Mr. Clerk, please call the roll.
Alderperson Rote. Aye. Stefanski.
Aye.
Vitale.
Aye.
Weigel.
Aye.
Shapleski.
Aye.
Haas.
Aye.
Lysick.
Aye.
May.
Aye.
No advisory committee report this evening.
Mayor Devine,
Alderman Lysick.
Park?
I move that we adjourn until our next regularly scheduled meeting, Tuesday, December 17th at 7 p.m.
Second.
Second.
There's a motion and a second. All in favor?
Aye.
Anyone opposed? We are adjourned.